Hi, good afternoon. This is Vicki. We're just waiting for people to get logged in, about halfway there. So we're just going to give it a few minutes. We're going to do something a little different, so appreciate your patience. We're out here at Jamestown and we've got our singers here. We're going to go outside and sing for you. And so we'll see how it goes. Thank you.
Something else, does it say they're talking? Because it's before it would kind of show down there that they're talking.
Hey, good afternoon. We're just waiting a couple more minutes for people to finish getting logged in, and we've trying to figure out a little camera thing here too. We'll be with you soon. Hi, it's Vicky. I don't know if you can tell who I am with my mask on. I'm trying to get the video set up to get started here. Thank you for joining us. So the plan had been to have our summit here at Jamestown at our new hotel, and that obviously didn't work out. So we thought it would still be good to do our opening here. So I'm here with Lonnie Greninger, our vice chair, and then some of our slalom singer, our warrior women. And I think we're ready to get started. Just can you make sure it's on. Oh, okay. Yep. We need to get closer towards Vicky. I can see Alicia. Go that way. I need to go this way. You need to go that way, yeah. And then there you go. You're all in, I think. Okay. Go ahead. I'll just do a quick intro of ourselves here. Hi, Squatchiness Shayacha, Lonnie Greninger here from Jamestown, and we are the Jamestown Singers, and we have two songs that we would like to share with you today. The first is a prayer song, the Chief Dan George prayer song, which was shared with all tribes from Chief Dan George from the Squamish Nation in Canada, and it was shared as an anthem for all tribes. The second song will be led by Alicia Adams, and that is We Sing Strong, and that was written by Port Gamble Slalom tribal citizen Joe Price. And it was shared with Jamestown in March of 2019. Pattingson. Are they going to be able to hear us? You can come closer, yeah.
Hello. Oh, sorry about that. Go ahead and. This is Vicki. Let's look at an echo. Okay. That's my speaker. Okay. Mm.
Can you hear me? Okay. Do we have audio back?
You do, I can hear you.
Oh, yay, thank you. Sorry about that. I forget when we come out to Jamestown, there's always some interesting things that happen with internet signals. So did you hear the end of the song, or just, I think it went out right before the end of the second song?
I think right before the end.
Okay. Well, thank you. Could you hear us okay?
Up until then, yes.
Okay, all right, thank you. So I'm not sure if Steve's been able to join us. They scheduled the IHS budgeting budget formulation call kind of over our meeting, although they were trying to get done before we were. So he's still not on. Okay, so checking our panelists to see who's made it. Okay. So want to thank you guys for joining us. This is just a very different way for us to have our summit, and I'm very sad that we can't all be together, but I know it's important for us to be safe. I'm going to turn on the camera. At least you can see me, and then hopefully when our panelists are speaking, you can each talk or turn on your camera. We put together a slideshow to remind us of all the work we've done in the past 8 months on the pandemic. Usually our summit is a celebration of the work we've done for the last 2 years and kind of looking forward to the next 2 years for the work that we will be doing. But we wanted to take some time and really celebrate the partnerships that we developed. I think we'd already developed them, but the partnerships that we worked through since the pandemic, since the stay-at-home order, basically in March. I've invited some people. I don't see all the panelists, so I might have to do some looking to see if some people got accidentally on the attendee side, but if you can bear with me. So right away, you know, after the stay-at-home order, I think we were all pretty worried about just being prepared and keeping our communities safe. And I feel like we were just getting, oops, I don't want to see me. We were just getting to work on some of the public health emergency preparedness work that we had wanted to do. And so there weren't a lot of emergency response plans in place for or ready for tribes. And so we did a lot right in the very beginning to get that more in place. So, and this is Lou put this saying on here: alone we can do so little, together we can do so much. And I really feel like our response has been an example of how important it was for us all to work together. So first, oops, why do I keep doing that? First, we had a phone call from Craig Bill, and I gotta turn off my camera. And he asked if we could help bring the state agencies and the tribes together somehow, help him do that, just because there was so many concerns, and we're trying to think the best way to start the communication. So we started the weekly state agency tribal liaison meetings, and we're now doing those bi-monthly. But I think in the beginning it was a really important place to start getting some communication going about, you know, what the response was, what the different agencies are doing, how funding was going to come down. And then with the Department of Health, there were lots of great partnerships, and this, you know, we've been building this relationship for years, and I think through this response, we've gone way forward in our work together. Lou staffed the tribal liaison officer position. The state health officer and the state epidemiologist, or Dr. Lofi and Dr. Lindquist, met with the tribes and really talked through what they knew at that point about the pandemic. And there were weekly meetings that DOH hosted, that they invited both tribal and local health officers. And then there were many joint AIHC DOH training webinars that we did. And then there was the work for the accessing data in the Washington State disease reporting system for the tribes, and really trying to work that through so that the tribes were able to support the response at the local level. With the Washington State Healthcare Authority, they really hopped on trying to help support telehealth and telebehavioral health. There were Zoom licenses for telehealth, loaner laptops and cell phones, and even some loaner laptops to help with some of the mobile testing that was being done at the different tribes. The Washington State Department of Natural Resource offered a DNR tower for a tribe to access temporary internet, which is something that tribe had been trying to do for years, and we're finally able to do just in the last months. But the Department of Natural Resources kind of hopped in and helped out too, in a place that we didn't know that they would, or think that they would be helping. Department of Commerce has also been working with the broadband access issue across the state, the mobile Wi-Fi's, and then they've had a couple of different funding distributions to help support the tribal response. And then recently they did a distribution to the urban programs and the programs that are working with some of the homeless urban Indians. Department of Transportation, some of the tribes are experiencing issues with people coming from the city and trying to go visit on their land when their reservation was closed down. So the Department of Transportation helped out with barricades and signage to help tourists know that they were not supposed to be on these lands. The Department of Agriculture compiled a list of food resources for the tribes. They addressed some of the urgent needs. They help provide food for tribal food pantries, and then they provided food for children schooling at home. I think that we even had a conversation with them once about how to access surplus airline food for tribes to distribute to their communities. In the Department of Corrections, we received weekly updates about what was going on with the prisoners, where they were at in their response in the different facilities, and how they were managing that. So I'm hoping that helps remind some people about all the work we've done. Sometimes when we work this hard, it's pretty difficult to remember everything that we did. So I posed some questions, and I'm hoping our panelists are able to answer. Again, I only see a couple of them. So Chairwoman Nelson, do you want to turn your camera on and your mic on? And I'll ask you a few questions, and while you're talking, I'll look for some of our other panelists and see if they got logged in as attendees.
Hey, Vicki, it's John Weisman. I sent a message telling you some of the organizers and panelists note who I see on the attendees list who are panelists. So if you're able to look at that.
Okay, thanks, John. So Charlene, here, you're self-muted. And can you turn on your camera? I know it was on earlier. Okay, well, if she's not ready, Andy, I know you wanted to go last so you could talk the most, but do you mind going first? He might still be in the IHS meeting. Okay, Secretary Weisman, sorry. Do you mind going first while I pick off some of the other?
Sure.
Sorry.
Thanks, Vicki.
Yeah.
So I think some of the things that I've been thinking about, oops, I'll turn on my camera too so people can see me. Great. Thanks, first of all, for the invite to be with you today. I really appreciate it. I think, as we look at responding to the pandemic, one of the things we need to think about is that underlying infrastructure and the capabilities and capacities that we all have to even respond through the normal work of certainly communicable disease control, as well as just what that means in terms of a pandemic. So, one of the things we've accomplished over the last year or so is, in terms of foundational public health services, really getting in statute the fact that the public health system is made up of 4 entities, that being the State Department of Health, the local health jurisdictions, the State Board of Health, and the tribes. And that was a significant, policy recognition. And over the years that I've had the pleasure of serving as secretary, we've really been working towards that. And that's been, I think, critical for us to recognize that that is the governmental public health system in the state, and that we all need to be coming together. And in doing so, funding that system, and with the resources from the legislature in, I guess it was the last session, we were able to secure some dollars for foundational public health services. And for the first time, really, the tribes were included in that. And I'm really pleased that that happened. So $1 million per biennium was allocated for the tribal epidemiology centers from the Seattle Indian Health Board, Urban Indian Health Center in the Northwest Portland area, Indian Health Board, the Northwest Tribal Epicenter. That was really key in terms of, data is one of those equity equalizers. If you don't have data, if you can't identify where there are inequities or who's getting services, who isn't, how people are being impacted, then you really come from this place of just, you know, being in the dark about what the issues are. So really pleased that that's been happening, as well as then the funding of the American Indian Health Commission to really define the tribes, to create this process, tribally driven and tribally led, about what the tribal foundational public health services programs and capabilities are, that work, you know, being done there, crosswalking that with the foundational public health services, and looking towards recommendations for continuing to fund those services. So I think a key piece to some of what we've accomplished over the last number of years is that effort, and getting that in law, and getting that to a place where, in terms of funding allocation, we recognize the formal government to government relationship with the tribes that is actually written into the statute. So I'm pleased with that effort. Vicki, I think you mentioned as well that we have the tribal liaison to the incident management team at the State Department of Health, and that's been a really critical role and a helpful one as we've moved forward. And again, structurally and from a systems perspective, really formalizing that relationship and actually creating a position for that has been key, I think, to allowing for both success as well as early indication of any challenges. The agreements that were put in place in 2017 in terms of the mutual aid agreements for tribes and local public health has been also, I think, an important piece. And I think there are at least 15 jurisdictions who have signed on to that. It would be great if more jurisdictions did. And recently we completed the consultation around the medical countermeasures, and that was work from H1N1, where we learned a lot in that in terms of distributing vaccine, and hopefully now we'll be able to benefit from that in the next 6 weeks or so as vaccine for COVID comes to pass in some anticipated time frame around that. And glad we have that formally approved. So I think those are some positive things. The meetings that have been happening with the American Indian Health Commission weekly, I think it has been, and the Department of Health and other Health and Human Services cabinet agencies, I think has helped us problem solve in real time issues around the pandemic. So Vicki, let me just stop there for the moment to see if there's anything else you want me to address now, or just wait for questions.
Thank you, Secretary Reisman. I know I appreciate all that. I think, the example you set in how to work with tribes has been really important in this response. But I also know you're leaving us. So the other part of the question is, what do you see for what we need to do in the next few years? But maybe you might have something to say about that, even though we know, you won't be with us, but.
Yeah. Well, certainly in terms of this pandemic, immediately is continuing to address the increase in cases, the surge that we're seeing in the fall right now. We're actually quite worried at the moment. We've had over 1,000 some cases now reported each day of the last 2 days. And so we really need to, in the very near future, near term, really squash this part of the curve. And it's going to take all of us coming together to make that happen. And then it's the vaccine administration. And I know we've been working with the federal government, as I know, Vicki, you all have. And I was on a call with General Patera, who's leading Operation Warp Speed earlier this week, and really reaffirmed again that the feds need to have this clear path with the tribes on receiving vaccine. So that's going to be critical. I think just continuing to maintain and strengthen these partnerships and make sure that we learn from our lessons as we go through these responses is going to be critical. So I think it's a bit more of the same while making sure that we've got the core resources in place that tribes certainly need to be able to mount a public health response. And much like local health jurisdictions, that's very variable in tribes and where what resources or services they already have and where they want to get those services. So continuing with the tribal foundational public health services in terms of the programs and capabilities is going to be key so that we're all on the same page and that we can get the resources that are needed to mount these kind of responses. And this isn't just responses we need in a pandemic. If somebody has a case of tuberculosis and doesn't have a place to safely isolate and quarantine or to isolate, you know, we need those places. We need those for other public health issues. So I think this is our chance and our opportunity to strengthen the system as a whole, not just for the pandemic response, but for the normal day-to-day public health issues that we encounter. So those are some initial thoughts, and happy, Vicki, to take more in questions and answers and engage with the panelists and their thinking around this as well.
All right, thank you, Secretary Weissman. I see we have the Speaker of the House, Representative Lori Jenkins. Thank you for joining us. Are you unmuted?
I'm unmuted now, Vicki. Thank you.
Sorry, you got put over with the attendees and not the panelists.
That's all right. It was great to be able to hear the opening. And it's wonderful to be here today, and it's wonderful to be on a panel with Commissioner Kreidler and my constituent, Secretary Weissman. So I always have to be careful what I say because he's a constituent of mine. You know, so I have to respond to him. You know, I'll try and be brief, and then I'm excited to answer questions. But I do want to first start off by acknowledging that I'm coming to you today from the lands of the Puyallup tribe. And it's been wonderful to work in collaboration with the tribe, both in my role as a legislator and speaker, and because I have another job working with the Tacoma-Pierce County Health Department, working in public health. And I've been able to work wonderfully with the Puyallup tribe in both of those roles. And I'm quite honored to represent members of the tribe in the legislature, and very much honored to have the partnership that I have there. I also do want to start out just by noting that, you know, the commission is, I think, 25, 26 years old, maybe. There's probably never been a more important time ever for us all to be working together on a government-to-government relations basis. It's, you know, your sovereign relationships and the state of Washington working together. That's the thing that's going to get people to stay through this in a healthy way. And when I talk about this, it's not just COVID. It's the economic situation that we're in, largely as a result of COVID. But you know, we've seen that it's created challenges for all of us, whether it's related to schools or I loved seeing your report at the very beginning, because, you know, we've worked together a lot on telehealth and making that work, and really the House has been really, I think, leading the way on working to help make telehealth work from a legislative perspective. Rural broadband issues, and actually just broadband issues generally, we've actually been able to see that we have as many challenges in our rural communities as we do in our deeply urban areas, and that creates difficulties for work, for school, for health, for all of those things. But I think, you know, one of the things I also want to just start off by thanking you for is your remarkable efforts in COVID response. It's been really wonderful to see the tribal communities really coordinate and work to share PPE and gowns and other resources, share them with the broader community, look and see where the need is, get things to you know, where they're needed. I think we've also between us done a lot of collaboration to provide technical assistance to make sure that we're really accessing federal resources as much as we possibly can. And we're hoping in the next not very long that there will be more federal resources to access. And that's I guess that leads me into just a couple things I'll talk about for challenges. As you all are probably quite aware, the state of Washington has a huge budget challenge this year, and especially for the next biennium. And we are really, that challenge gets much larger if we don't have federal partnerships. And if we don't have a federal package to come and help local, state, and tribal governments make its way through this. And so we're going to be working very hard this next session on that. And this next session is going to look completely different than any other session any of us has ever seen. It's likely, I speak for the House, but I think the Senate's going to be mostly remote, maybe not as much as us. We're planning, we're working to plan on a fully remote session. It's very important to us that we be able to do the work of the people, and that we do it in a transparent and accountable way, but that we do it in a way that the public is safe, that members are safe, that our staff is safe. And John talked a lot about disease rates, and unfortunately, we're not expecting perhaps them to go down before session starts. It is one place, I'll just tell you that while he hasn't been right about very much else, I'd be very happy if our president were right that we were turning a corner. I don't think that the data is bearing that out right now, but I'd be happy to have him be right and praise him for being right if he only were. So that'll make legislative session very different, but we're working really hard to make it accessible to people and doing a lot of work behind the scenes on that. I think session will be governed a lot by COVID response. And when I say that, I talked a little bit about that in the beginning of my comments. What we're starting to see is how much I guess COVID illustrates to us that everything in all of our communities relates to everything else, right? You know, we would love for businesses to be able to open and open safely, and are very supportive of that. However, it's equally true that the public is not going to come to most places. I think you all have seen this in a lot of ways, is not going to come if they feel like their health is threatened. So we've got to address that. People can't go back to work if there's not childcare and if the schools are not open. Even to me, even climate change has become really connected to COVID response, because we see lots of data that folks who live in places with less clean air have much more difficulty surviving and recovering from COVID. So these things they're an ecosystem unto themselves that COVID has had an impact on. So I think that'll be a big area that we focus on. Certainly, police accountability is something that the House Democratic Caucus is working on a lot. I'm very proud of the work that our caucus is doing and feel really good about the work that we've been able to do. And it's been good to have, we're starting to have kind of long-standing relationships with our sovereign tribes on police accountability issues, and that's when we really have a strong base for that. So that's been wonderful to be able to work on those issues with you. And then I guess I'll just wrap up by saying the other thing that my caucus has made a commitment to for this session is that everything we do, whether it be budget, whether it be COVID response, or whether it be police accountability, we are going to do that using an equity lens. For too long, we have not taken into account sometimes the effects that our policies have on particular communities, and much of our work this session is going to be actually putting different communities at the forefront when we do our analysis of the impacts of policy and budget decisions. This will be the first time that we've done it, and I guarantee you that it won't be perfect, but we're absolutely committed to doing it, to learning, everything that we can learn while we engage this year, and then to improve and do better and better. So we'll be asking for your help as we do that also. So I will pause here, and I see Commissioner Kreidler is also here. So I'll be anxious to hear your questions and be anxious to answer them. I would just tell you, I do have to do a brief 5-minute phone call in the middle of Commissioner Kreidler's comments, but I'll be back.
Thank you. Do you mind? I really feel like it'd be a great follow-up to have Tony Lodge, the CEO of the Native Project, go next after Speaker Jenkins' comments, because I know you've got the right things to say here, Tony.
Well, welcome, and thank you for inviting me here today with all of my friends and some people I know. So we'll leave it at that. I'm just kidding. I'm Tony Lodge, and I'm a citizen of the Turtle Mountain Chippewa tribe of North Dakota. My tribe yesterday, the day after the elections, shut our borders for the first time ever in our history because we have over 200 active COVID cases in a couple of weeks. Our northern border is the Canadian border of our reservation, and of all the things I've been through the last 8 months, that one really made me the saddest. Knowing our elders and our people that are shut in. The restaurants are closed, the gas station is closed, the tribal offices are closed. The only thing open is the hospital, and there's not a bed in the hospital on our reservation for people to be in. I'm a storyteller, I guess, and Native Project is one of the 2 urban Indian health clinics here in Washington State, the other being Seattle Indian Health Board. Everybody tells me I'm a storyteller, so I'm gonna tell the story, and you guys are gonna say, oh, she's getting old because she keeps repeating herself. She keeps telling the same story over and over. But Native Project was the first clinic in Spokane County to have a positive case on March 12th, 2020. It was a Native woman from a neighboring state in a little apartment with her children who was very sick. And Dr. Lutz, our public health officer, called me at my house on Saturday morning and said, well, it has begun in Spokane County and it's begun in your community. And I think that was a foretelling of what we have experienced in the last 8 months. That very disproportionate 3.5 times greater impact in the Native community. That day, my only thought was, how are we going to get our staffs safe? It's really it's the narrative from on the ground. So much fear, but I just saw, excuse me, so much resolve with our staff. A third of our staff went home immediately. Remote work, a third of the staff were on standby on unemployment, and a third of the staff, mostly the hands-on practitioners, the doctors, our nurses, behaviorists, stayed as essential workers, and we never shut down, not even for an hour since this whole thing has begun. The sad thing for me, but it's also the awesome thing for me, is we were not ready, and I'm pretty sure we're not the only clinic in the state that was not ready for the magnitude of what we were going to experience and see, and how much PPE we needed, and how much testing supplies we needed, and we had none of that. And thank God for AIHC, thank God for the Portland area office. I think a couple years ago, they allowed urban clinics to access the federal supply chain, the warehouse in Oklahoma. We got N95s from the warehouse in Oklahoma. There were 10-year-old expired N95s. So my staff worked for 100 days with 10-year-old expired PPE, and that was not unusual in the Indian community. And again, I just have so much. My staff and others around the state are such healthcare heroes in the Native community. For the courage and the commitment, like I said, never to give up. We too started getting organized. Lou Schmidt is another healthcare angel helping to get us the supplies we needed. The Healthcare Authority and the American Indian Health Commission getting us together. But you know, all of the external partnerships and the people we had to get in contact with, swing into action, paled in comparison to how much fear there was inside the building with patients and with staff. We went from 0 telehealth capacity to doing 80% of our patient care telehealth in 2 weeks. We were like ninjas. We spread out. We bought every laptop, everybody's like, where'd you get all that stuff? I'm like, well, I'm not ever going to tell you, but we got hooked up and we did telehealth like in no time. We changed our HVAC system, retrofitted with air filters, ordered HEPA air filters for every room, every lobby, got furniture out, got different furniture in, got touchless bathroom faucets, toilets, touchless doors, plexiglass, isolation room, what do you call it, thermometer kiosks, and just if I did not know, I would think we were all military veterans with the precision that we changed our clinic and the precision that we put the word out, testing, lining up, doing testing. I was so annoying to the National Indian Health Services. I begged for an Abbott machine like I've never begged for anything in my life as a healthcare professional. And I mean, I know I just wore them down because I'm pretty sure we didn't get it in the order that we should have got it. But it came one day and the nurse one of the nurses said, hey, our Abbott came. And I'm like, oh, I gotta go see this wonder machine. So I went downstairs and it looks like a little toaster. I'm like, really? A thing that looks like a toaster will save people's lives? And I'm like, you know, we got room for a lot of those. We can put them here. But anyway, so we started doing testing. We partnered with the other community health clinics because they did not have the advantage in HRSA and the community health world to have IHS with us, to have that straight up connection with the federal supply chain. We gave 1,000 swabs one day to the fairgrounds because they were out and there was people lined up. The fairgrounds did the community health testing. But one of the other really amazing partnerships that came out of it was the Group Health Foundation here in Washington State called me up one day. And it was after our little mom stuck in her apartment and we were all scared. We really didn't know what to do. Even our physicians were like, we don't know how to treat this disease. They said, we're just going to give you $100,000. Just go help people. I'm like, well, what do I have to do for it? Then they're like, here's $100,000. Go help people. So I said, we buy food. We bought food with it. We bought Barbies. Of course, a little Native child had the first inflammatory disease in Spokane County. I'm like, she needs a Barbie. We're going to buy a Barbie. We've been able, with no strings attached, to provide actual relief and care to our families. And I'm just going to say what I've learned from all of this, whatever little I've learned from all of this, is that there's never going to be a new normal. It reminds masks are going to be like seatbelts. You know, we've had this huge public health campaign, wear your seatbelt. Doesn't mean people aren't going to die in car accidents, but it sure lessens the amount of people that die in car accidents. I think we're going to be wearing masks for a long time. I know I'm wearing mine. One thing I've learned about public health, because our medical director is also a public health officer for Okanagan County, we've had the privilege of learning every day. We have a 20-minute huddle on Zoom every single day with all our staff, checking in, learning about COVID, learning about assuaging people's fears, finding out what our patients are saying, finding out how scared our patients are and how stressed and anxious and depressed they are, as well as worried about their health. But I think for all of this is we're going to have to flatten the curve, not just on disease, but on racism and on about wealth inequity. I am on the Governor's Safe Start Committee, and we are going to have a listening session next Tuesday at noon, which we'll tell you a little bit more about later. We are still the winners in all the loser categories, according to the research. You know, we have the most food insecurity in the Indian community in the state. You know, we have the least access to digital and technology. And in Spokane County, apparently 40% of children have not log onto their distance learning in a regular way. And guess who those kids are? They're our kids. How do we, there's people from 300 tribes that live in Spokane County. So it's not just a tribe, and we talk about tribal sovereignty. I'm a tribal citizen. My citizenship does not go away because of my zip code. And so we need to talk about tribes and tribal citizens, and direct services to tribes and tribal citizens. I think the other thing is, it's been very hard to get data. When the first data came out and they said, you guys have 5 positive cases, we're like, no, we have 15 positive cases. So the identification of patients has always been a problem. I see we have our clinic director, Dylan Dressler, and Sheena Birdtail in our behavioral health program on. I mean, those guys did amazing trying to identify accurately who in our community was sick, who in our community has been affected. We trained our own contact tracers through AIHC funds. But I do think the other thing is, for me, this summer, we run our programs with prevention for children. If you have no children in the building, you're not building the future. You're not building resiliency. So we partnered with Better Health Together, our ACH, and Molina, one of the managed care plans. Mr. Kreidler will be happy to say that. They donated money. We bought laptops for kids. We did our prevention program virtually. Everybody got really excited. Kids Indian dancing on the computer. Kids reading and doing their science on the computer. But I do think our children in their homes, we're incubating a whole generation of trauma and PTSD. In our therapeutic programs, we have 5, 6, 7, 8, 9-year-olds. A lot of those kids come from foster care and the child welfare system. They can't access services digitally. What's going to happen with them? Even though we've had these really good ideas, how to connect community and how to create community. We actually have 2 virtual talking circles a week, one for children and one for teenagers, just to give a little bit of relief to our kids. I do think, and the last thing I think for the future is the challenge in our workforce. I'm almost at the end of my career. I've never seen my employees so stressed out as they are right now, doing virtual schooling, having 10-year-old expired PPE. Not now, thanks to Lou, we have good PPE. But how much stress it takes, it's taking a toll on employees. Already a couple of our employees quit. They said, we just can't deal with this. So I worry about the future of our workforce. It's the oxygen mask. If we can't put it on ourselves, how are we going to save to help the whole community? So with that being said, I am a storyteller. Just you should like this or a timeout. I would have quit talking. So thank you very much for listening to me. And I see my good friend Andy Joseph.
Thank you, Tony. Thank you. And can we go quickly to Commissioner Kreidler, and then Andy will go to you, and then Pam, and we'll see if we have Charlene, and then I think we have Marianne Lindeblad from the Healthcare Authority. Oh, and okay. Commissioner Kreidler, you're on.
Thank you. Thank you very much, Vicki. I really appreciate the invitation here to be able to join with you all today, and it's an honor to be here among tribal leaders. It's also an honor to join such other distinguished colleagues on this panel. I want to do a special shout out to a couple of people. Fawn Sharp in particular for the Quinault Nation and for her keynote address to my recent climate summit that I held she was spectacular. Vicki, we've worked together so many years now. I remember getting my start with your organization way back when when I was the regional director for Health and Human Services, Region 10. And it's been a great long-standing working relationship. And most recently, working closely with you on the issues related to behavioral health and the grant study that we currently are conducting on behavioral health. Your participation has been very much appreciated. The recommendations will be shortly presented to the legislature, like next month. And so we're in the process right now of getting that ready to address that issue that you helped so much with. And Lou Schmitz, the American Indian Health Commission, I want to express my appreciation for everything that you've done, not the least of which is to help us with our work group that we had dealing with resilience, disaster and resilience. News about this effort and recommendations will be out here very shortly. And you played a very instrumental role in helping us put that information together. I also want to thank Lee Shipman of the Shoal Bay Tribe for her participation as well with the resiliency work group as well as Lou Schmitz. Native voices are especially important since the tribes are on the front lines of climate change, and we need to make sure that we're doing everything we can to help them. You don't expect this when we're talking healthcare to be hearing this from the insurance commissioner, but it is an important and critical issue, and I'm glad to have your support and working relationship. Let me just say quickly that the Office of the Insurance Commissioner, but no more than about 10% of our workforce is actually in the building out of 240 employees. Most are working virtually. We're doing at least 1,000 Zoom calls a month. We're open for business. We're meeting the deadlines, honoring our commitment to protect consumers. Suspending any prior. One of the things that I have the authority to do here is to issue some emergency orders, and I've done so by suspending any prior authorization requirements that might be necessary around the COVID-19 testing issues. I've also waived the copays and deductibles for testing in order to make it that much easier for testing to take place. Payment parity when it comes to telehealth visits, in particular for behavioral health visits, have become critical, and it's something that we've aggressively moved on with by making it a requirement that be available. Telemedicine visits are especially important during pandemic, particularly for those who live in rural areas of the state. Something that I think maybe we've learned some lessons from that we can carry over and deal with in the future. I'd also like to mention quickly one of my primary issues, very primary issues, is going to be the ban of use of credit scoring when it comes to personal lines insurance. And when I say that, we're talking about automobile insurance, homeowners insurance. For years, I've never liked it as a practice. It has significant financial consequences for those who are impacted, and particularly during a pandemic where you wind up with many people, essential workers, needing to have their vehicles and needing to have insurance, and making it that much more difficult for them when they've wound up in a situation, in many of their cases, because of the pandemic. But even without it, it's clear there's a disparate impact on people of color, of lower income, and it's something that should be removed. It's discriminatory, it's unfair, and I look forward to working with the tribes to see if we can end this practice going forward. We have something like 20 organizations now that are with us and helping us to successfully advocate for these changes. This has been a problem that it's been long recognized, and I think the pandemic has only heightened our awareness of the unfairness involved here. This is not because they're concerned about whether they're going to pay their premiums for car insurance, for example. This is about trying to make an argument that you're more likely to file a claim, an insurance claim, and that's what they're using it for. And quite frankly, not everybody should be put into the same barrel and judged the same way by using credit. It's terribly unfair, and I want to see it done away with. This is a history of unintended racism that's been part of our society for too many years. This is one of the artifacts that's still out there. It needs to be changed. If we don't do it this year, it'll be next year or the year after, but its days are numbered. It is terribly unfair, and it just is not correct. When we started to talk about race, the CEOs of so many of the big insurance companies in this country came out with very strong positive statements about what needed to be done to make sure that people were treated equally and fairly. I'm going to hold them to their commitment when it comes to an insurance companies. Let's see if they mean it when it comes to eliminating a practice like credit scoring, so that we wind up making sure we're not making it that much more difficult for many of these people who are essential workers to have the kind of insurance coverage they need at an affordable price. And that is something that I'll be working hard with the tribe and with so many others to make sure that we make a real change in how we do business. With that, Vicki, I'll turn it back to you, and thank you for this opportunity.
Thank you, Commissioner Kreidler. I don't see Andy now. This is like whack-a-mole. Oh, there you are. Andy, do you want to go next, or did you still want to be last?
I could wait to be last, I guess. Thank you.
It's up to you. We can ask Steve to go, and I don't know if Charlene Nelson was able to get her mic and her camera to work again. Steve, do you want to go ahead next and talk about?
I can. I feel like I'm already talked out today from my morning meeting that went into the afternoon, but so I'm trying to reflect back on and we're talking about partnerships and working together, I think. Is that what you want me to address?
How the partnerships have gone. What are some of the successes that you saw, lessons we're going to take forward with us into the next part of the response, and and anything about equity.
Yeah, so I think that when you discuss partnerships, all you have to look at who's on the panel and who's in the room today, I guess. We're where we are today because of our partnerships with the state, with our locals in most cases, and also with each other's tribes and with our urban programs. I think that's we're stronger when we're together, and we help each other. It doesn't mean necessarily that things always go the smoothest that we would like them to go, but we work through things and come to solutions together, I think. And so I only heard probably the last part of your presentation, Mike, but we've really appreciated the work that you and your staff have brought to the table, helping us fix some of the things that need to happen in this state to work together on. Yeah. And I think a lot of times some of the things that we ask to get fixed actually benefit the whole state also.
True.
And so I think that the COVID-19 is kind of the thing that's I mean, I go back to all of the work that we were doing on foundational public health services that's gone on now for some years, and the work that we've made, and that's such important work. And it really becomes amplified when we're in now this COVID-19 crisis. And so our ability to work together, our ability to figure out how to get things done, our ability to help each other back and forth between tribes and the state has been why we're where we are today, I think. And I think I'm a lot more confident right now working with the state on our solutions around moving forward with COVID than I am working on the federal government side of things and the things that flow out from the federal government. And so I am so thankful for all of the dedicated staff that all of the departments have working together to take care of all of the things. You know, we were up and having telemedicine going, and we've stabilized some things, and in many cases we've in my case, and I think many tribes cases, we still had ongoing access to real people when necessary. And that's because we had PPE in place, we had support systems in place, we had testing in place, we had public health protocols in place to be able to get us through this. And they're one of the biggest tribes in the United States right now is only doing healthcare through virtual medium. And so I know that the ways that we've helped each other is helping us take care of all of our patients that are out there, all of our family, all of our extended family members, all of the people that we take care of in our system it's only happening because of the work that we've been able to do together. And also the people that aren't on our meeting today, for the most part, are our staff that are back in all our departments and our organizations, dedicated to doing this work, pulling together. And I want to call them out because many of them are on the front line, especially if you're in the healthcare business. They're on the front line and they're making sure that everybody's getting taken care of. And so I'm having, we know that so many people are hurting right now because of our economic climate, what's happened because of the constraints in dealing with this that it's put on our daily ways that we've done business. And I'm hopeful when we talk to our public health partners at the federal side, the state side, and the local side, that this has brought it closer together and will bring us even closer together in our working relationships. I know that I sit there looking at John, and this will not be the last time I see your face, John, because I'm going to be coming to visit you in your office here, and you'll be getting a call from me probably next week to set up a time because I have something to bring to you. But the foundation that you built with my tribe in Southwest Washington on the public health side is a model that really exists in few few parts in this state, in this country. And so still today, when I talk to your health officer, he thinks that the way that we do business together is the way that all of public health does business together. I guess he just doesn't see any other way of doing business. And so I look at the people on the panel, and I look at all of the organizations that we're working with together, and our legislators, and all of the things that we've accomplished in these last 2 years, and this last year. And we'll be doing some celebrations, I think, with each other at the upcoming Centennial Accord, I think, are only because of the relationships that we've developed together and the ability to have sometimes hard conversations with each other, and still get down to the business that we need to take care of. And so, Marianne, I want to particularly call out all of the work that the healthcare authority's been doing with us. And Andy will be chiming in here in a little bit later, because he and I were working with the Portland area on submitting the Portland area as part of the, well, historically, I guess this last year was a $6 billion IHS budget, and we're hoping for a lot more. But when I talk to the people in the other states and I go to these meetings, they don't have the same relationships that we have. And so I'm thankful that I live in this state. I'm thankful that I do business in this state, and I'm thankful that we have the people that work together on all of this. And so I could go on. So I know that a budget crisis a little bit is looming for us in this state, and I hope it doesn't derail the progress that we've made in working to put together a public health structure in this state. So I represent Oregon, Washington, and Idaho in a CDC a technical advisory committee. And I've challenged them to start supporting the public health structures of tribes in this country. They haven't been doing it. They have one of the biggest, even though they've taken some cuts, they still have one of the biggest budgets out there. It's unbelievable, the budget that they have. And I've been telling them they need to start sending some of this money to tribes. They need to work with tribes who are working with our state and who are working with our locals to step up the game on this public health infrastructure. I think John and I can say we're tired of this roller coaster ride and the ups and downs that the public health system has taken, because we no more than have a crisis and we build things up and we think that we have infrastructure in place to take care of things, and people with their short-term memory forget why we're where we are that we needed to go, and pretty soon we're on the downhill ride of the roller coaster, and that needs to end. And so that's going to take all of us working together now, also with our federal partners, with our legislature and each other. And I want to go back now and talk to our tribes that are here in this meeting. And I think I was trying to see, what did we have, about 80 or 90 or something like that? I think that I looked, we're at 90 right now. We kind of ended our meeting this morning because all of the Washington tribes bailed at the last minute. Isn't that right, Andy? They all bailed at the last minute because this meeting was important. And the reason that Andy and I weren't there was we had this other business that we had to take care of. But I want to say that we're also stronger in this state, and tribes in this state work together like no other place that I hear about in this country either. I think Oregon tribes for the most part work together, but not like the way that we do. And I look at the California tribes, and some of them don't even talk to each other, and some of them work against each other. And we're not that way. And I hope that we'll never be that way. And so I want to talk a little bit about the future. And I know that you heard some good words from John, because I listened to an inspirational presentation and a discussion that he had at the last State Board of Health meeting. And I know that we have a hard hill to climb now as we're moving forward, starting to roll out this vaccine. And just having, I mean, right now, I'm having trouble getting enough providers sometimes to get the flu vaccine out to everywhere it needs to go, because we can't seem to hire enough nurses. We can't seem to hire enough medical assistants. And by the way, medical assistants, Healthcare Authority and Department of Health, they can only work in the clinic. So unless I send a provider out there and they're working under their jurisdiction, they can't go out in the community and do immunizations. They can't go out in the community and do immunizations. And so we're going to need to take, you know, I've heard some discussions about doing rapid training on and I don't know how Department of Health is going to deal with this, but doing rapid training to give all kinds of people training on how to give immunizations out in some of these community sites that we're going to have to get up and work together on. And all of the work that we're going to have to do together as tribes and with our local health jurisdictions, with trying to figure out how to meander through this vaccination process. I will tell you that I believe that the tribes in this state, by and large, most of them are probably going to select to go with the state COVID-19 distribution system instead of dealing with the uncertain things that are happening on the federal side. So I have great hopes that we can pull together as communities, as Native communities together, and help each other. That if some of our providers and Marilyn Scott talked a little bit about that. I mean, what does she do if one of her providers comes down ill? They might be without a provider. If you're one of these small tribes and you're without a provider, and you now can't even provide the most basic public health functions, this is where we need our mutual aid agreements that I can't seem to get my tribe to sign. Because I don't know, you know, I mean, there's too many lawyers involved, I guess. But we're going to need to be working together with each other, and to take care of all the populations that we serve. I have some deep felt responsibilities with my program in Seattle, and so I'm disappointed that we geared up to provide a bunch of flu vaccine to the urban Indians that we serve in Seattle. And it seems like most of them don't have a history of getting vaccinated with the flu, and they don't even want to get vaccinated with the flu. So I'm not sure what's going to happen when the COVID vaccine comes around. And then what are you going to try and give it both to them at the same time? Which, I mean, they really ought to be having both of these vaccines. And so we're going to have to do a better job together of the public health, of the announcements and the education of our communities about the importance of this, about the importance of the most basic things, which is taking care of some of the vaccinations with each other, and the flu vaccines. It should be having a high uptake in our communities, and we're not finding that to be the case. So I don't really know how much time I have. I don't know if Vicky's given me the.
You missed my text message.
Well, I just heard my text go off, and I thought that might have been about you. So I think that we have challenges, but we have more opportunities to do these things together than we have opportunities to mess it up. So I guess having said that, I'll go ahead and close. Thanks.
Thank you, Steve. It's good to see your face for once. I forgot the order that I gave. Molly, do you want to go next? Is that okay?
Sure, yeah, I'm happy to. Thank you. And thank you for having me join you today. I'm very happy to be here. I just want to also thank the tribes and the commission for their amazing partnership. We, throughout this whole experience, you know, I think starting off, Craig Bill was really adamant about pulling the tribes together, and the governor was as well, about having some early conversations with the governor to really kind of hear from the tribes about what they were experiencing as COVID was taking off, and as the you know, what was happening as far as we were approaching kind of the stay home, stay healthy situation, and really wanting their input, knowing that you know, being sovereign nations, that, you know, the states rule, the states kind of stay home, stay healthy, you know, all those didn't apply, but that it was a real partnership between governments, and that was really important to the governor, and has been ongoing. He has really appreciated the insights of the tribes, and also the partnerships, and that many of the tribes also, you know, adopted some similar measures to protect your populations going forward. And so I just want to kind of echo that the governor has really appreciated that partnership, and will continue to do so. You know, I think when we're looking forward, I think some lessons learned, I think, that are important to reflect upon as we're going forward is many have been highlighted here, that the health inequities that we've seen and have been highlighted by COVID, they are not new, but are certainly have been highlighted by COVID as something that we in the governor's office take very seriously, and are trying, we see this as a real opportunity to address some of those, at least in ways that we can try to move forward with those. So that is going to be a focus for our office, and I think you'll see that reflected as well in different ways in the governor's budget as that comes up, you know, later in the year. So, you know, to another point around public health funding, this is definitely something that is most definitely on the, you know, has been brought to light about inadequate funding for the public health system, and something also that the governor has his eye on as something that needs to be addressed as we move forward. This pandemic isn't going away anytime soon, and the next one could be right around the corner. So we want to make sure that public health funding is available, and that tribes have what they need to have their system built up for public health, so that they're able to address these problems as well in partnership with the state. You know, I think some other lessons learned is that we have learned that communication is so important. I think a lot of these kind of ongoing conversations have been really critical. I have weekly calls with Vicki and Lou, and am grateful for them sharing their experiences and what the issues they are facing. It really helps to understand not only on kind of a high level the issues facing, but very much on kind of a week by week basis what the latest kind of issues are. And, you know, just echoing Lou being so amazing about being, you know, she was in the emergency operations center from the very beginning of this, and has really just been diving in on so many different issues. So I think it's been, she's been a very valuable asset, and we have appreciated her engagement on the state side. So, you know, I think we have some lessons learned around, I think, data and making sure we're communicating well with on data and what, you know, really checking in with tribes on data collection in some areas. You know, I think we did some lessons learned around some funding issues, you know, particularly around FEMA cost sharing. That was kind of a back and forth with the state in different ways. And so I think that's something that we just need to do some longer. That has been a lesson learned about needing to really plan that out ahead of time so we're not providing mixed messages to anyone. Hopefully we worked through those, but I think those are some important lessons learned. And I think going forward, we really want to make sure we are focusing on addressing these issues, addressing the inequities, and remaining, you know, the strong government-to-government relationships that we have with you, and continue that to really be a model, hopefully, for the country. So thank you, and thanks, Vicki. Appreciate the opportunity this afternoon.
Thank you, Molly. And yeah, thank you for your continued partnership with us through this response. It's been great. Just, you know, keeping up with each other and making sure that communication is open. It's been very important. So thank you. I believe we have Chairwoman Nelson unmuted now, and I don't know if she's able to turn on her webcam. Charlene?
No, there I am. I'm not sure whether I'm on. Share my webcam. Okay, it wasn't my end. It was somewhere in the middle. But I'm on now, and I've listened to all kinds of interesting conversation, which I really enjoyed. And you said many of the things that we all have in our hearts. One of the things I think as I'm listening is, if I'm looking back 15, 16 years, something that we have unique right now is the beginning of trust for each other. If you put trust in someone or an organization, that's really good. So I think that we're doing that. I'd like to say that everything that has not been easy, and that's not been easy for all of us, so we can share that. But health is about the most important thing. Well, that's health and safety is pretty well my top things that I want to happen for my tribe, but not only for my tribe, but the people around me. Because you can't set up fences, and I don't think tribes had fences. So when we look out now, we want to help not only our own tribal members, but we try to help the people that are around us. And again, I would say that the trust that I have, I believe the Governor Ensley, when he began to say something in February and March, and I think I beat him by 2 days by closing our reservation. So that definitely showed I trusted, and I am very proud of the fact that we're working together now on our county and our tribe on all kinds of health issues. And when vaccines come, I think we're going to be working together with that too. And I think that shows growth for all of us. Mossy.
Thank you. Marianne, I think, are you ready? Thank you for subbing on short notice for us. We appreciate that.
There, I think I'm unmuted.
Yes, you are. Thank you.
No, that's not a problem. I'm very happy to be here with you today. I was planning to be listening in anyway, so just playing a little different role than I initially intended. So Sue unfortunately was able to join you today, and I know she certainly sends her best wishes for a successful summit. And so far, it certainly is a successful summit. And again, I'm very honored and privileged to be able to be here today. And just quickly kind of share some thoughts, and then just a few of the successes, and what we've been doing at Healthcare Authority since that day that we all got that first phone call about, or many of us did, about the nursing home in north of Seattle in Kirkland, and what has transpired since then. It really required us to quickly pivot, as you can imagine, in terms of from how services are provided through the Medicaid program. And first, just preparing our staff. We were really fortunate. A number of our staff were already working remotely, but quickly within just days having, over 1,000 people that moved from working in their offices or their buildings to remote work. But I think we've done that very well. We, of course, really wanted to make sure, too, very critical is how to make sure that our members continue to get served. The folks that are enrolled with Medicaid, the folks enrolled with our public employees and teachers programs, to make sure that we had capacity, our providers had capacity, and our health plans that we contract with were ready to make sure that providers would be quickly reimbursed, that when utilization was dropping, that they were supporting providers to make sure that those providers would still be around at the other end of this pandemic, a real concern for us, certainly. But one of the first things we did was looking at telehealth. And fortunately, telehealth, telemedicine, we had already advanced much of the approaches already through the Medicaid program. So it was fairly easy to implement, making sure that we were paying on a parity level and that we had a robust telehealth program. But then, as you've heard from a couple of folks already, it wasn't just having telehealth for the providers, but what do our members need? And many of our members not having phones, not having access to certain things, certain providers not having ability to implement telehealth easily. So we were able to mobilize very quickly and get over 6,000 telephones out to both providers and Medicaid enrollees that they would be able to use during this pandemic. And got 2,000 Zoom licenses out to providers. And I know certainly with some licenses to tribes, and then also made laptops available on loan so that the equipment would be there. We also needed to work closely with CMS, just in terms of being able to put in state plan amendments, waivers, whatever we needed, so that we could again serve the members very quickly. Couple things that direction from CMS immediately, which we were able to put in play immediately, is not terminating folks. So no Medicaid client is being terminated until the public health emergency is over. And also our benefits stay the same. So we can certainly add new services, but not take anything away. So some really positive things coming out of the emergency in terms of how to serve folks and making sure that they don't lose their health care in the middle of this pandemic, just because for whatever reason they may no longer be eligible, or because of the disruption of the pandemic, just not even being able to get whatever paperwork they needed to get filled in. And again, working closely with our partners at the Health Benefits Exchange to be able to put things in play so that folks didn't lose services. Also making sure whatever waivers that we needed from CMS were quickly in play, and working very closely with our CMS partners to do that. I just heard something. You've heard a little bit about testing, certainly making sure that we had our reimbursement systems in play, what we would pay for, that sort of thing. A huge piece of monitoring, as I mentioned a bit earlier, the capacity of providers. And with many providers, with the utilization going down, they had to lay off folks. They had to close, maybe reduce their hours. But we wanted to make sure, and especially with our behavioral health providers, which many of the tribes do a significant work with our behavioral health providers, making sure that they were able to survive through this. Many often are small providers. They don't have the same sort of financial backup. So primarily working with our managed care plans, our 5 managed care plans, to look at unique payment methodology, looking at more advances of payment, any sort of approaches that could create more stability for those providers. We were also monitoring very closely and touching base literally with our SUD providers, substance abuse providers on a weekly basis, just to make sure they were maintaining capacity and understanding when they had to close down that what kind of capacity we were losing, so we knew what was out there in terms of providers. Fortunately, much of that capacity has come back, and the good news that we're hearing is a lot of the services are sort of back to where they were, again, being offered much through telehealth and other mechanisms. But certainly with another surge, that could change, and we will be back to where we were. In addition, just looking at ways of being able to share information better, so working with the Department of Health and others on mechanisms to create more opportunity to share information about testing and that sort of thing. We're working with Department of Health on the vaccine planning. We have other initiatives that are going on that will just strengthen the agency as we move forward. Certainly looking at how we reimburse rural hospitals, for example, and really strengthening the rural health delivery system. And we'll be working more closely with tribes on that work as it starts to unfold. And also looking at reimbursement for primary care providers to have a more value-based, more performance-based reimbursement system. As you know, we did some major redesign of our behavioral health delivery system over the past 3 years. It's certainly not, continues to be things that we're tuning up, that we're working with the tribes to make sure that the system is responsive to the needs of tribal members, and know that everything's not perfect and we need continued work and continued conversations about behavioral health, how it's reimbursed. And we've done a lot of work in the last few months about building and more capacity and more relationship building with our managed care plans and the tribes. Also, I just want to mention too, and you've heard this mentioned throughout, is addressing health disparities. And certainly COVID has just really elevated our attention to health disparities. Unfortunately, needing this to do that, but we certainly had been working on disparities, but this just has accentuated that work and how we address things like health equity. So just to know that our agency is just now right in the process of doing a recruitment for health equity, social justice, and strategy manager. So that work is underway right now. I also just want to thank you all for your participation in the variety of committees and opportunities for you to comment on different things that we're doing, and our close relationships with the tribes, and how much we really appreciate this. Certainly COVID has accentuated that, but I just really look forward to our continued relationships, strengthening those relationships, and I see them become even stronger as we pull together to get through this, but then just having truly a stronger delivery system when we come out the other end. So thank you. Thanks for the opportunity to be here with you today.
Thank you, Marianne. I appreciate it. Oh, looks like we lost someone. Pam McEwen from the Exchange, you want to go next, and then we'll go to Andy, and then we'll be wrapping up. Thank you.
I'm unmuted. Yeah, I'm talking to myself.
There you
go. Thanks very much, Vicki. The Exchange is really honored to be included in this really important discussion about the partnerships and how we've responded to COVID-19. I feel a little humbled being here with some real heroes of this crisis. The Exchange's role is pretty focused, which is to get people covered by healthcare. And so that's something that we have leaned into pretty hard during this situation. And we're well aware of how hard the tribes have been hit by COVID-19 and the subsequent economic crisis. It's been really hard on our state, and particularly, I think, hard on many of the tribes. When we first, heard of the cases and kind of where we were headed, it seemed really important to open coverage to as many people as possible. That was one thing that we could offer, particularly partnering with the Healthcare Authority and with the OIC, of making health insurance as available as possible for people at all income levels. And we were also able to move, because we're a highly technical organization, we were able to move pretty quickly to fully virtual environment. Getting the word out is the biggest thing and being really challenging. And this is where the partnership became really important, because the exchange liaison, we were able to meet weekly with the tribes and the tribal liaisons to get information out about the special open enrollment period, and particularly to partner in responding to the furloughs and closure of tribal enterprises. As I think that we, during that time, we had 200,000 people come into the exchange for coverage. I think people were thinking about health coverage really differently when faced with this crisis, and incredibly important for people to know they have no barriers to testing or treatment during a global pandemic. And now we're into our official 8th open enrollment, and we have 78 active certified tribal assisters, and we have 23 individuals who are in the process of finalizing their certification. Ongoing training and support is incredibly important, and we're doing all of this on a completely virtual environment now. And our Tribal Advisory Work Group continues to meet monthly to identify and address issues, programs, and activities that may have tribal implications. And our tribal sisters have been really valued contributors to our Navigator program, particularly during days of in-service training. And I think there's a lot of learning that goes in both directions. Subjects that we've been recently covering are assistance to tribal and Union Indian membership, as well as information about casket care, which is kind of our newest version of the qualified health plans that are on the exchange, which provide better coverage and lower out-of-pocket expenses, and also a more understandable health descriptions of health benefits, so that people can actually use the benefits that they're eligible for. Coverage has meant access to care for people, and over 63,000 American Indian and Alaska Natives are now enrolled in the Washington Health Plan Finder through Medicaid expansion and qualified health plans. And I think we owe a huge debt to the efforts of the tribes and our partners in getting people enrolled. And recently, the exchange was able to put in a technical change that I think is really important to the application process for American Indians and Alaska Natives, in that now they can apply for health insurance on the same application for family members that are eligible for different sets of benefits. And this may seem like kind of an arcane thing, but for families who one member of the family qualifies for one set of benefits, another member of family doesn't qualify for those. This to be able to apply on the same application is something that the tribes have been asking us for since the day we opened our doors, and we were really happy to be able to kind of go through the heavy technical lift to make this possible this year. And I think the timing is really important right now, as people need coverage more than ever. A few things that we're going to be focusing on in the next year are really getting a deeper understanding of the barriers to actual enrollment and how we can collectively work to overcome them. And this means looking at all facets of the work of the exchange, including policy, outreach, communications, operations, training, and technology. And as I think, as Marianne was saying, is through the equity lens that this is very, very important. And then we want to continue to expand the premium sponsorship program. The majority of the state's tribes have taken the training to become sponsors, and we hope to increase sponsorship participation. And then we want to further modify our tribal assister recertification program, so development of training materials will also assist customer support network, which means other navigators and our own call center staff to know much more about tribal benefits and protections and eligibility, and the role of the tribal assisters in tribal communities. And then we're looking to expand the Navigator lead organization procurement to include a tribal lead organization for next year. We're currently working with a Native project to help pilot some program elements, including enhanced user designation for tribal issues. And then we want to energize even further our tribal assister work group. This is a really valued resource that has been underutilized, and we've been working with them and participating work group members to identify areas where this group can really bring meaningful change in the areas of education, enrollment, and equity. We are really going to work hard to continue to increase efforts to achieve equity in healthcare. And we believe that the relationship and support of the tribal sisters is the heart of these efforts. We are stepping up efforts so that all navigators understand the AIHC special protections of the Affordable Care Act. And in addition, we are going to be continue to focus on outreach to urban Indians who are not connected to any tribal program. We deeply value our working relationship that we've built over time, and we know there's always room for improvement as we work on this relationship. And it is through this that we can assure that American Indians, Alaska Natives have access to the affordable coverage and opportunities that have been presented by the Affordable Care Act. Thank you for the opportunity to be here today. It's an honor to be here, and we appreciate so much the work that you're doing and the partnership that we have with you.
Thank you, Pam. It sounds like somebody's computer's dying. I made an error and I skipped over Chairman Peters from the Squaxin Island Tribe. He wanted to make a statement, and then Councilman Joseph will go to you, okay? And then we'll wrap up. Thank you. So are you unmuted, Chairman Peters?
Yeah, can you hear me?
Yes, thank you for your patience.
Of course, no problem. Let me see if I can share my webcam here. Okay, so I appreciate you having me on today. I'm not available for the rest of this summit. This is the only chance I get an opportunity to speak to you all. And as I'm finding out, it's tribal and state and federal government consultation season, and I've got multiple things on top of multiple things. And so appreciate you giving me a chance to speak today. My name is Chris Peters, and I'm a member of the Squaxin Island Tribe, and I serve my people as a tribal chairman. And I actually have a concern to speak to today. I don't want to be the Debbie Downer of the group. I know we're talking about relationships, and I do appreciate the relationships that we do have with the state and our partnerships throughout the state. But I did want to have an opportunity to speak to a concern in regards to some of your policies and dealing with Medicaid and managed care organizations. And I also have to apologize because I am monitoring 2 summits at the same time. I've been on a call with the Department of Interior all day, and I have that going on the screen, and I am in their queue to speak as well. And I'm about 2 people down from speaking on that, so I'm going to jump off of this and go on that in a minute. But I do have staff that is going to be involved in this summit over the next several weeks, and will be available to speak to more specifics. I'm going to speak kind of broadly today. But I do thank you all for allowing me a chance to speak today. I did want to take a moment to talk about partnerships and equity because those are 2 words that should be synonymous. But often we as tribes have to work really hard to make sure our partnerships with the state are truly equitable. It shouldn't be that way, but it happens. It's gotten better, but it still happens from time to time. And unfortunately, what has happened is our policies, things that are written from a long time ago, are getting in the way of us truly moving our partnerships forward. As most of you probably know, the Squaxin Island Tribe owns and operates the Northwest Indian Treatment Center. And this is an accredited residential drug and alcohol treatment center in Western Washington that specializes in culturally specific treatment for Indigenous peoples, and with specific attention on addressing generational and historic trauma. You know, this form of treatment, culturally appropriate care, is paramount to the health and healing of our people. And we really need our state partners to fully support and honor our ways of providing culturally appropriate care. And as I was stating before, this goes much deeper than words. We need you to ensure that your agency policies do not interfere with your agreement to support our ways of care. And so what we're asking for is for you to start taking the side of tribes and urban Indian health programs when it comes to who knows truly what's best on how to care for our American Indian and Alaska Native people, opposed to the managed care organizations. It's something that we've been butting our heads against for quite some time. And unfortunately, this ongoing problem with these MCOs, we have found over and over again, the state has supported them more and more than they have supported us, quite often based because of written policy, according to the state. And every time we think we resolved an issue, another one comes up. And each time this happens, the state supports the policy to allow the MCOs to interfere with the care we provide to our Native populations, our own communities. This happens over and over again. And this is also occurring in behavioral health and patient care as well. And so we're asking that your agreement with us to be more important to you because some of your policies are inequitable. You can't always claim partnerships and equity, then hide behind inequitable policies that do not support our culturally appropriate care. You know, it's simple. We're asking that you take a look at outdated policies, outdated standards, and create policies and standards that are aligned with tribal partnerships that are equitable and support our people, that support our way of treating our people. When there's a conflict, we often seem to own the burden to do more, and so that it's easier for the state and their MCOs. So in closing, my question is for the rest of this summit, and that I ask that we resolve is what will agencies, the healthcare authority specifically, but others too, do to ensure their policies are equitable and do not interfere or disrupt what the Indian nations and Indian healthcare providers are doing in regards to culturally specific care. Thank you. My hands go up to all of you. I appreciate all the work you're doing over these next few weeks.
Thank you, Chairman Peters. We're going to go to Councilman Joseph, and then we'll give a little time to answer some questions. We got a few questions, and Marianne, I don't know if you wanted to make a comment.
I can certainly wait till after.
Okay, thank you. Okay, thank you.
Can you hear me now?
Yes, we can. Thank you.
Hello, good day. Badger's my Indian name, and first of all, I really want to thank you know, our governor with this pandemic that we've been dealing with, and actions that is taken, and recognizing our tribes that have sovereignty, and to me that's very important to recognize, you know, we're sovereign, and I really want to thank the staff and everyone that made this pandemic, you know, a real state of emergency in our state, and actions that have taken place, showing the state and the rest of the nation that this is real, and it could cost people's lives. It did cost some of our people's lives, and you know, I also want to thank the work, you know, the state did, and American Health Commission, and the Portland Area Health Board, the urban health centers for their statistical numbers that they shared with us during the different meetings and webinars that we've been attending. You know, without that language, we're not able to really, you know, look at how to react to some of the issues that CDC or the Department of HHS, how they want to how they consult with tribes. It helped us prepare to, do that consultation. Steve mentioned one of them, and we had the Region 10 meeting, and on the vaccinations that and the process on how that's going to work out. I don't really agree with this warp speed stuff that is coming, and some tribes are totally afraid of the vaccinations. There's past history where we've been I guess put in a bad way. The historical blankets that were given out to tribes that had smallpox on them, and the outcome of that when the H1N1 came, and I remember I was in DC, and Kathleen Sebelius was in her first week, and that pandemic hit Tucson, and she wasn't really familiar with our AIHC process on how we get vaccination, so she ordered that it all go through the state. Well, to my tribe, that was a real huge mistake because of the two counties that my tribe has to deal with. My people never got the vaccination really from the counties. The neighboring county actually followed the rules and regulations, when that vaccination came about. And so, being able to meet with the commission and with the tribes is really important to air that out. And I actually aired it out with the CDC, a couple of years after that H1N1 at their headquarters. It cost some of my people's lives, and now the cost of that is costing the government even more money, because these children don't have a dad that was bringing in income, to feed them and clothe them and house them, and these children are growing up now, and they're under like the welfare sort of bracket, so it costs the government more money in the long run. If they would have provided the vaccinations in the normal process that tribes was used to, having to make a decision on who's going to give us the vaccinations when they come in such a short time frame was pretty hard. And the work between the commission and the Portland board on putting out a letter expressing our concerns about the vaccination, I really appreciate all that work, and the statistical data that we put into doing that type of work. The meetings that we've had with the state also gave us a chance to I guess compare numbers, compare how the virus is affecting different tribes in the state, and some of the actions that we've taken to prevent the spread, and the work on trainings for contact tracing, things like that. They save lives, and I want to help thank the state and the board, and the health commission, and also the ones that's working with the CDC on getting that information out to us. It's really hard on dealing with webinars in some areas. My tribal system would go down, and I'd have to use my own personal cell phone and laptop, because not all tribes are really equipped with the the high technology that we deal with these days, or the system goes down because we're in a real rural area. But anyway, I just want to thank everyone for working together, and kind of to tag on a little bit with Chris Peters. Prior to my getting back inactive with my council, I got reelected in July, so I was part of a couple calls with the state. And anyway, at one time, the Healing Lodge of Seven Nations was dealing with the similar issues that Christopher Peters just brought up. And anyway, we shared those same sort of issues. I think we worked it out with Jesse Dean and CMS in working on an enhanced encounter rate that helped our tribe through those issues. And I know Jesse Dean is working on doing something similar with the treatment facilities, and to me that's very important that we get that work moving forward. Always got to put in a pitch for our urban health centers as well. We need to make sure that they're included in everything. The Native Project, for instance, my tribe has the highest population that they serve, over 2,000 of my tribal members there. And so being able to be part of these meetings with the people like Tony Lodge and with the Seattle Indian Health Board, and just sharing numbers, it gives me, I guess, good talking points to try to help them out, because if we leave them out, they're going to come home to my tribe with the limited resources that we have, and so that's really important. And working in partnerships with each other, tribe to tribe is very important as well. I got to hear how things were working, and some of our traditional practices that we use. The COVID is very stressful on a lot of our people, and just today and working on the IHS budget, we've seen statistical data on opioid use, and the numbers are going up during this pandemic, and so knowing that, we know we got our work cut out for us, and I kind of would say that kind of helps me agree with Christopher Peters on the treatment and being able to treat people in our traditional ways without having to deal with the MCOs. But like I said, Jesse, probably by working with CMS, we can kind of take care of some of those issues, and so with the enhanced encounter rates would allow us to operate our facilities in I guess a more traditional and sovereign sort of way that will actually save the government a lot of money down the road, and it will save lives. So some of these best practices can be shared with the state, and maybe they might follow our models, for treatment and save the government, down the road a whole lot of money. So that's kind of what my tribe's encounter rate for our nursing home facility is. It's actually going to save the state a lot of money, and that's pretty important. Plus, it brings the resources to our tribes, and it also helps our local economy and provides a better quality service to our patients. So, it's a win-win all the way around. It's just a matter of, looking at different ways about, helping our people. And anyway, that's about all I really have to say. I know we got to try to stay on the agenda and move forward. Just want to thank everyone for that do work with us and listen to us. White Lim Lim, thank you.
Thank you. And thanks everybody. Did anybody else have a comment? I have a couple of comments from the question panel. Marianne, did you have?
Yes. Can you hear me?
Yes, we can. Oh,
Oh,
your
okay.
camera went off, but we can hear you. Oh, there you are.
Okay. Thank you. Well, first, I do want to acknowledge and thank Chair Peters for his comments. It is an important issue. It's one that we are engaged with the tribes on, and we've got 2 roundtables scheduled, one in November 24th, one December 7th, and a consultation. I think it's on the 15th of December to address these issues. Again, they are critical, they are important. We need to get them resolved, and we look forward to working with you all in getting to a resolution, because being able to provide culturally competent care to your members are so important to the tribal members. And so I really want to work this through with you. So more to come. And please stay in touch with me if you have any other questions or concerns along this line or other issues. Do really appreciate it. Thank you.
Thank you. We did have some comments from Marilyn Scott. Just she says, and Marilyn, I think we can unmute her if we want, right? Oh, maybe she. There she is.
It's muted by okay, she's unmuted.
Marilyn, we think we unmuted you if you want to speak.
I'm sorry, Vicki, I had to go out of the room for a minute.
Oh, I was going to read your comments, but I just thought maybe you might want to speak.
Okay, sorry.
Yeah, no problem.
I wanted to just congratulate Commissioner Kreidler for his re-election and thank him for the recognition of the premiums and the credit scores. I hope that reinforcement. I know that when you establish policies in the state with the insurance oversight, it has helped us with our Indian healthcare system before. But I know that when we had our summit before, we had tribal leaders raising issues around not being able to get insurance, homeowners insurance, various other types of insurance because of some of the issues around credit scores, around other various issues. So I just want to thank you for that recognition. And also I wanted to just thank Secretary Wiesman for the recognition that he provided, the guidance in the state with our government to government consultation policy, with the establishment of the declaration and the pandemic in the state and the jurisdictions that tribal governments have, and providing the guidance with Dr. Lofi and with Dr. Lindquist, including the tribal healthcare systems, the tribal public health officers and the tribal administrators, with the state leadership in addressing the pandemic and the care for our people. So thank you so much for that guidance in the state. But I also want to just thank the panel of state representatives in recognizing the differences that tribal governments have in the state. So thank you, Marianne, on behalf of Administrator Birch, in the waivers, inclusion of addressing issues that we have with our telehealth, and the need for being able to get communication with our patients, and the cell phones, and having the computers, the licenses for telehealth. Thank you so much. Thank you, Vicki.
Thank you, Marilyn. Any other comments, questions? Well, people are thinking. I just want to thank you guys for joining us and having this conversation. I think we've really learned in this last 8 months, I mean, last 11 years, 25 years, however many years you want to say, but really in the last 8 months, the importance of being able to communicate and work together and really honor each other's beliefs and ways of doing things, and help support each other in keeping our communities safe. So thank you so much for the work that you all do on a regular basis.
Yeah, this is Steve. I wanted to say something just to follow up with Chairman Peters. It seems like when we talk about indigenous ways of taking care of our people, we know best. And SAMHSA has been told over and over and over again that they need to honor those ways.
Mm-hmm.
And they need to tell you, the state, so you can tell the managed care plans to pay for that. Because we want to provide them with services and treatment that's going to make a difference in their lives, not just pay for a visit. So that's what I have to say, I guess. Thanks.
Steve, thank you for your comments. Well stated. Appreciate that.
Thank you. I don't see any other questions in the panel. Not very good at this, so sorry. So thank you for sticking with us. Yes, thank you. So we appreciate you all joining us, and I think we're going to take a couple of minutes to switch over to the Pulling Together for Wellness Framework presentation. So thank you all. Have a great evening.
Thank you.
Thank you. For those of you that can stay with us, we're going to have a conversation about the Pulling Together for Wellness Framework, and it fits right into the conversation about indigenous methods, culturally appropriate care, and how we do our work in a tribally driven way. So we'll give you all just a couple minutes to go do whatever you need to do, and we'll be back. Let's be back at 3:33. Is that a weird time? Okay, that's 5 minutes. Thank you. Okay, well, there we go. So as I said before the break, we have Jan Olmsted, who is part of our public health team at the commission, and she is gonna give a presentation on the Pulling Together for Wellness framework, and I think she has some of our tribal leaders to help her out with the presentation. Jan? If you're talking, you're not unmuted.
Can you hear me?
Yeah, now. Yes.
Can you hear me now?
Yes,
Vicky?
go ahead.
Yes? Okay, great. Okay, thank you. And can you see my screen?
Yes, that's the full slide now. Thank you.
Great, okay. The Pulling Together for Wellness framework is a comprehensive, tribally driven, and culturally grounded prevention framework developed through the guidance of Washington tribal and urban Indian leaders. It integrates Native epistemology and Western science, and it is evidence informed. Today, I'll have join with me some of the members of the Leadership Advisory Committee that has guided the development of the framework. Marilyn Scott, who's the Vice Chair of the Upper Skagit Tribe, Charlene Nelson, Chairwoman of the Shiwater Bay Tribe, Charlene Kreis, the Vice Chair of the Squaxin Island Tribe, Andy Joseph, who's Councilman for Confederated Tribes of Colville. And I know that there are others who are on the Leadership Advisory Committee that are participating today. So I certainly welcome their comments as we enter into the panel portion of the presentation. Just a bit of a pause here. I'm Chumash. I'm a descendant of Santa Ynez and Barbareño, California Mission Indians, where I actively am involved, continue to be involved, and have a great love for my Chumash people and the traditional territory where my ancestors, the strength of my ancestors comes from. I've lived in the Pacific Northwest as a guest on the tribal lands of the Nisqually and the Squaxin Island people for over 40 years and have made many close relations here, some of which I consider my extended family. I'm a mother of 4 sons and have recently become a grandmother. My granddaughter, Jayla Okush, which means otter in Chumash, is 4 months old, and that's been a really great transition and joy for me. So I dedicate my efforts in this work towards the future of my granddaughter and her generation. So I'm honored to lead the development of the and implementation of the PTW framework, along with tribal and urban Indian leaders that are on the Leadership Advisory Council. I've been working on the promotion of culturally relative public health and addressing health inequities and the integration in strategic planning for a long time. Early inspiration for this work comes from the work of Connie McLeod and in the Puyallup tribe. And as a student of many of the elders and leaders here in the Pacific Northwest, both tribal and non-tribal, including Sue Crystal, who was the former director of the Healthcare Authority, and her husband, Billy Frank. Here are the members of the Leadership Advisory Committee. I won't go through and call them all out, but I think it is really an honor to work with all of these folks, and some have been really involved since the beginning of this work, and others have joined on later. And so we'll get into the content, and I'm going to go through this pretty quickly because I know that we have a very limited amount of time, and I want to make sure that our leaders have an opportunity to share their perspectives about the framework. This work started actually in response to addressing commercial tobacco prevention and cessation efforts. And we heard very clearly from tribal leaders that it's not just about smoking, that we needed to go deeper. We needed to step back and take a broader perspective of what this, getting to the root. So the early reflections of the PTW framework were really about establishing the linkages among all of the public health work. At this point, this was in 2012, we identified certainly the maternal infant health work as a foundational work, and also the partnerships that so many of the panel before talked about, the importance of state-tribal partnership. I'm going to call out just a couple of things here in terms of challenges. If you go down to the bottom of this graphic, you'll see upward arrows that say data here. And there's many challenges with the data on the state and federal levels, including definitions of race and elders. Recently, we, in some of the work that we're doing, just a recognition that data that's collected on the federal level was really established in terms of defining elders at a particular ages. And for our population, it's much earlier than that. So just one of those, one of those issues about how data does not necessarily work to our benefit if it's not defined appropriate to fit our populations. Missing, and then also just missing from data sets. And the focus on the negative stories rather than the strengths and resiliencies that really are that are part of our communities and based on the survival of our ancestors. And then if you go down between the two data points, you'll see just some of the knowledge base of historical and that was thought to be really important in this work that was not necessarily present yet. It was just about during a time where ACEs was becoming better understood in the state, but we were talking about, we need to know more about the connection to historical and intergenerational trauma and the inequities that exist, as well as social determinants of health and how racism has impacted our health. We were looking to integrate how historical trauma the impact of historical trauma on the rates of ACEs and became involved in the neuroscience work. And that was the direction that we had gotten from tribal leaders. One other thing that I'll just mention here is the importance of the engagement at the leadership level to ensure the long-term sustainability of work, and then the engagement of community at the community level to ensure that whatever strategies were really specific to that community and actually were effective in the community. Here, I'm just going to call out a couple of things. One is that tribal leaders also made it clear that culture, and you'll see this image here that is of the medicine wheel that reflects health in a holistic way, physical, mental, emotional, and spiritual health, and how they're all interrelated, and that culture is really connected to all aspects of our lives. This is a definition that was created through multiple iterations of drafts and review by elders, tribal leaders, youth, and others that that, you know, finally came up with this definition of a healthy tribal and urban Indian community. Another piece of the framework is the heart of the framework. Again, multiple iterations with input from leaders, youth, students, community, tribal programs, and experts. And this has certainly been shared very broadly in multiple venues. But we call this the heart of the framework that carries the definition, and then vision and values. The vision and values reflect some broad strategic thinking that is about a life course approach, which we refer to as the 7-generation philosophy. Culture, again, as a key factor in all elements of health. The importance of traditional values, community and place-based strengths, social ecological framework, and connecting to the world around us, knowledge and expertise that are based on community wisdom, and again, the integration of Native and Western epistemology. Here's the framework itself. And, you know, our population has been in crisis for decades due to the prevalence and rates of chronic disease and health risks, which are the effects of unresolved grief. There has long been an association with risky behaviors. CDC and other agencies have shaped interventions based upon this thinking. The distinction of our work has been to call out the importance of tribally driven and community-centered engagement, and the principles and strategies identified in the development of the PTW framework, a holistic approach to health, physical, spiritual, social, and emotional. We use culturally grounded strategic thinking in the development of policy systems and environmental change. Leaders and experts that have guided this work were clear about the making the connections to emotional wellness as part of this holistic view of health. Our approach has been with intention in addressing historical and intergenerational trauma, and ACEs as a foundation to understanding root causes for behaviors that have been linked to unhealthy coping behaviors and diseases of despair. We do this by focusing on both raising awareness about historical and cultural context of American Indian and Alaska Native people, as well as educate on the effects of racist policies and practices linked to roots of our disproportional health experience. We have also learned over the course of this work that strength-based understanding from within community and cultural historical experience is fundamental to developing and selecting what's effective to specific tribal and urban Indian communities. COVID-19 has forced a change on the environment in which we operate and has forced change upon us all. This shift has forced open some eyes to the experience of trauma and prolonged crisis so that others outside of our experience are beginning to have a different level of understanding. The Pulling Together for Wellness framework is a culturally grounded and evidence-informed framework. It was co-designed with tribal and urban Indian leadership with input from youth, elders, and in many forums where we sought input on state, regional, and national venues, tribal venues. You can see here a couple of things that I'm going to call out again is that this is the medicine wheel with culture at the center, but here down here, you'll see that these areas were called out in the development of this work as a base of knowledge that was important to begin to achieve that holistic health. And that was called our healing work, which we're now calling generational clarity. Knowing that the medicine wheel did not originate in the Pacific Northwest, but the tribal leaders felt that this really resonated with most Indian people, and that it reflected well that whole concept of holistic health. Also reflects 4 directions, 4 stages of life, 4 seasons, and many ways of understanding the world around us. A couple of other things that I just want to call out is that because I won't have time to go through all of the elements here, but storytelling, which is one of the broad, again, strategies. It's that balance of data and stories, and telling our own stories, truth telling about history, the stories of elders and ancestors, their survival, and how that continues today. And we see that through the revitalization of language, through cultural traditional practices and ways of life that are carried down generationally. One other thing, a couple of other things that I'll just point out is, again, the importance of leadership engagement and in recognition of tribal sovereignty, and knowing that leadership really must be involved in this work in order for it to be sustaining. And then engagement of youth and elders. And we hear about this repeatedly, the importance of that. We hear from the elders, we hear from the youth as well, in terms of how that strengthens them. This is an image that we use to reflect our generational clarity work. And I'll just say about this: first, do no harm. Ways to integrate historical trauma into the AIHC and neuroscience work. We were beginning to really dig into how would we integrate that work, historical trauma and AIHC work. And this was prior to the trauma-informed territory being as supported as it is currently, but this term generational clarity actually came from a conversation with my son. I had met a young girl who was very, very rooted in her culture, and she I was really overwhelmed by her presence. It was just so powerful and strong, and thought, wow, this is something that I wish I would have had as a young girl. I didn't, and certainly something that I wish for, the future generations. And I was explaining this to my son and got a little bit teary-eyed, and he said, don't worry, Mom, because of the work that you and others like you are doing, our kids will have generational clarity. I took that terminology to the Leadership Advisory Committee, and they thought it was really a good term to use, because the term historical trauma can be re-traumatizing, and generational clarity really invites us to sit down and look at this from a different perspective. And so that's what we've carried forward. We do some work in generational clarity that is around training that supports that notion. These are the 20 competencies, core competencies for the Pulling Together for Wellness framework. And just broadly, the first section is really about understanding the framework. The second is really looking at historical context. And the third section is about community assessments and data and surveys, and really understanding the population and them understanding it. The fourth is really that cultural knowledge and context. And the fifth is about telling that story, sharing the story outward. And I know they're in boxes right now, but that's not really how the work flows. This is an action planning process, just knowing that everyone is at a different place. This, even though there is 1, 2, 3, 4 steps, It's really not intended to work that way. One of the things that's called out in this work is that it's important to have a historical memory of the work. And so telling the story should start at the beginning and should carry on throughout the work. This is another framework that is used with our youth in leadership development, and it's all about scope of influence. And, you know, this work, it's really important for tribal leaders to be engaged in this work, to set, and elders actually, to set the youth on the right path here. And this has just been great work. In fact, this group wound up, they came up with many things and presented to their tribal council. Here, some of you who have, probably many of you have seen this before, but I think the important point here is that American Indian, Alaskan Native mortality rate is about 71% higher than non-Hispanic whites. This is in Washington State. And tobacco use plays a significant role in this data. Here, the point of this is, first of all, the great work that was done in the Behavioral Health Improvement Act that was passed last session, and the inclusion in the introduction of that legislation that called out the disparities that exist within the American Indian Alaska Native population in the state, and really making that connection to the adverse childhood experiences and the higher rates that are experienced by our population. This is about how data is collected. I look at this as a gold standard, a quote from Charlene Nelson here, but really it's about, again, just that idea of really knowing the population the way they know themselves. Again, just that balance of studies and stories. There's a great video here that really describes and is a great example of how a story can carry through the words of an elder, the cultural knowledge keepers, policymakers, and youth that really give a very thorough context and really complete the story. And this is really getting into some of the more tools of the framework, but I just wanted to show them to you that the vision and value statements that are part of the heart of the framework, that they're not just aspirational, they're operational. And we put them in operation through this matrix. I'm going to just briefly show you what that matrix looks like: vision, goals, outcome indicators, and then strategies. And these are developed specifically to projects that are being worked on by specific tribes or specific communities. Again, just another example. This one is in food sovereignty work. This generational clarity and 7th generation strategies, they go hand in hand. Our work in generational clarity is to support cross-generational healing through the course of life. And that, you know, the 7th generation strategies is about that reach and who you're responsible for, standing in the center, in understanding your current context, looking back 3 generations to your parents, grandparents, great-grandparents, thinking about what their experience was, the wisdom that can be drawn from that experience and knowledge, and carrying that forward to understanding your current context, carrying that forward to planning for the future for the next 3 generations. It is cyclical, and it isn't age dependent. You're the 7th generation if you stand in the center. And that is an understanding that came from one of the Lummi elders who's no longer with us, who shared that with us, and we asked if that was appropriate to use that understanding for this framework, and it was agreed to. She was agreed to that. This was in a meeting with the Lummi leadership, Lummi Council, and then it was adopted by the Leadership Advisory Committee to carry that understanding forward. Okay. And then just that generational clarity, this isn't a conversation with the governor, where generational clarity was explained in a meeting, and this was having to do with maternal infant health and the meeting that the governor had with people across the state that were and Steve was Kutz was on the panel with the governor and talked about generational clarity, and the governor was very interested. So we had a conversation after that panel discussion, and he said, I think this is a pretty profound idea, and he was real curious about how we were rolling this work out. And I had told him that we had a sprinkling of funding from the Healthcare Authority to do this work, and he said, no, I mean, this work needs to be in our education and in our training programs. And so we were really delighted to hear that. Again, the 7th generation concept. And I think about that too in terms of the reach, the stretch of your responsibility. If we're fortunate enough, we have the possibility of knowing our great-grandparents and knowing our great-grandchildren, and that's the reach. So the reach of responsibility through that 7th generation concept. So with that, I am going to go to our panel. And Vicki, can we have our panel pulled up as presenters? Vicki?
Jan?
Yes.
If you are a panelist, you should be able to unmute and turn your camera on. There's Marilyn, we see you. Hi, Marilyn. We lost Charlene Nelson. I'm not sure if she's driving. Who are we missing? Okay. Okay, so you guys should be good to go. Go ahead.
So Marilyn is the first panelist. Marilyn, are you there? There she is. We can't hear you, Marilyn.
Sorry. I was asking Jan if you had already did your presentation. I had to go out of the meeting for a bit.
I did. So I'm finished with my presentation. So yours should just roll right into where we left off. And then I think Charlene Nelson is going to try and call in. So we'll work on that while you're speaking.
Okay, great. Thank you so much. And I thank all of the leadership, tribal leaders and state leaders that are joining us today, all of our tribal representatives that are joining us this afternoon, taking the time out to share the information that we have with regards to the Pulling Together for Wellness framework. It's so important that we share the the models that the tribes can relate to and that work for the recognition of our tribal communities and our tribal people and the way that we live our lives. And I just know that it is so important for us to share the model of framework that works for our tribal people and our tribal communities. The recognition of the wellness models that we have, the public health foundational work that the state has been doing. We have our own version of indigenous health standards and measures that tribes establish with our communities and the tribal government, and utilizing the framework that has been developed here, and also having the generational clarity that we all have with the historical trauma, the experiences that our tribal people have had over time. I can't emphasize the importance of the tribal sovereignty, recognition of the sovereignty of each tribal government. And we are all a little different. We have similarities, but we all have a little bit different ways of taking care of and addressing the issues that we are faced with in our tribal communities and the protection of our tribal citizens, as well as the non-tribal citizens that live within our reservation boundaries. I can't emphasize the importance of the tribal governance. And as an example, with the COVID pandemic, when the governor established and declared the epidemic and the pandemic in the state and closed the borders of the state, and all of the businesses were closed due to the COVID, the governor reached out to the tribal governments and communicated with the tribal leadership of the importance and the understanding at the time how serious this virus was, and for all citizens to be considered protected was a way to have the tribes also consider the recognition of needing to close the businesses within the tribal communities. And the tribal government, the leadership of the tribes had went back and took into consideration the need for establishing their own declaration for their tribal communities and reservations, as well as the businesses within the tribal communities. The importance of establishing the recognition of governance that the governor had for tribal governments. I know that we are lucky, the tribes of Washington are very lucky to have the recognition within our state in the experience we have with government to government, and the Centennial Accord that has been established by our former leaders from many of our tribes, having the recognition of the consultation process that tribal governments and the executive leadership of the state. It's so important that we recognize the knowledge and recognize the traditions and the cultural ways of our people. At times we don't have the same policies and traditions, and at the same time, many times the tribal governments sometimes utilize some of the standards and policies that the state has in place in order to consider revising those codes, policies, and laws to meet the needs of our people and within our tribal communities. So we thank the state at times for allowing us to utilize some of those policies, laws, and standards that are in place. And also we are looking at the opportunity to utilize the model, the Pulling Together for Wellness model with the, at a national level, not only within our own communities, but for there to be standards established and recognized with the public health foundational definitions that the state has established, but also to recognize the model that we have taken into consideration with the national level and the CDC standards and measures that are established for American Indian Alaska Native people. And so with that, I think, Jan, I would just turn it back over to you and have the rest of the panel go forward. Thank you.
So thank you, Marilyn, very much. I'm just checking in with Charlene for just a moment. So we're going to just pause for a second. Okay, we're gonna try this. We have Charlene on my phone, and she's gonna go ahead and speak into my mic through her phone.
Oh, okay. How's it going? Do you hear me?
I don't think so. Let's see. Here we go. Try it again.
Okay. Can you hear me?
We can hear you.
Yes, they can. Oh, this is working. I'm so happy.
It's working great. Okay, I'm sorry. I had to come home and I had to stop before I got here. Pulling Together for Wellness was something that we started at our tribe in a very simple way, meeting together and talking about what could we do to go back to be where our ancestors had been in health. And that means beyond a long time ago, beyond the bird ships, to go back to think, how can we make our tribe and our children and their children and their children's children, 7 generations, more healthy than they were now. And you know what? It really helped to call in not just ourselves who are sitting around the table, but to have the youth group, our youth got together, and some of our high school, and some of now we have what's called a core group, and they're kind of a middle-aged group that work together, and the elders. And out of that, we decided that we could do some things. We wanted people to be healthier. Well, then we have to know each other, know what we were working toward, which was actually to move forward by moving backwards or thinking backwards. And of course, the elders, who are the elders of now, had things to say. We did a send out to everybody, but we didn't to fill out what did they think if they were staying at home yet. What do you think we could do? And we sent an adult that couldn't say anything and a young person with the paperwork. And it was the best thing that I can think of that we ever did, because things came in that we did not expect. And we've had meetings with our elders and to look at our different generations and their generation, called generational clarity. And it was remarkably wonderful, because they were speaking, and they were speaking of things that happened to them that affected their lives and affected all kinds of things that can make you not as healthy as you want to be. And so it actually, it was just awe-inspiring to hear people. You just looked at them all of a sudden in a different way, because people don't usually go around saying anything, you know, unless they're asked to. And I think that's what's important. We talk about, we work with our government at state level, at federal level. We work with other tribes. And you know what? We build up a trust for each other. And I think in even that one meeting, I saw trust built up. And it was really awe-inspiring. Anyway, we're still working at this. We now have a garden, which gives us some fresh vegetables and things that are so good that I've never tasted anything like that. But anyway, that's sort of where we are at this time, and working maybe in a slightly different way than we were before, but we're still moving forward. And our youth leadership, I mean, they're great speakers. We're trying to work on a action plan that's connected to what we really are, where we are. Because we have to tell the story. No one else can tell the story because it's ours. So it has been an experience that I'm very pleased to see that people are so involved. And we've done some things this year because it has to be virtual, but on phone. And in fact, we'll be passing something tomorrow, I think, that will again fit under Pulling Together for Wellness. And that's probably just about all I can say, but the fact that we're working together. And I think that is, we said that with our many people today, that because we work together, we're moving in a good way toward a good goal. And so this is, for us, a very, very important goal. And that's about all I have to say. Mossy.
Thank you, Charlene. Thank you so much. I'm glad we worked out the ability for you to continue to stay with us for this panel. Your voice is just always such of great value and a blessing. And now I'm going to ask Charlene Kreis to be the next speaker. There we are. Okay. I'm going to go off camera, I think. Yeah, I don't need to be on camera. Okay, Charlene.
Good afternoon, everyone. It's such a delight to be here and to listen into the discussion. And as I was looking at the screen, I'm looking at the American Indian Health Commission logo, and it has the 4 feathers, 4 directions, very important to Native society. Here in the Northwest, our tribal people had a teaching we have the teaching, it's called Gwazaret, Teachings of the Ancestors. And these teachings do include the north, east, southwest, infant, child, adult, elder, spring, summer, fall, winter. And they're very much similar to the teachings that we call the 4 directions. Of course, they include the 4 directions. Very powerful teachings, because in these teachings, we value each segment of where we're sharing with the people. When we talk about infant, we believe that the infants are starting very early to gain their literacy of when they're in the baby board or with their mothers in this society today, that they are listening, they're watching, they are beginning to learn, they're beginning to read everything they see, they are reading. We believe that the child is very important. Children hear a lot of things. they are like sponges. They know so much going on, and they may not always share with us the sorrow, the heaviness that they're carrying. But children, they do. They're there. Adults, we have adults that are like preteens, teenagers, that they carry the weight on their shoulder. And these young adults, they have quite a perspective and understanding of what's going on. And now we have our elders, the wisdom, lots of wisdom, but they also carry that historical trauma. So when I look at the framework of pulling together, it is so inclusive to what we need to work on, not just yesterday, but today and tomorrow. Because we as tribal nations, we have been in some of the roughest storms ever in our canoe. And we've had some really good skippers and some strong pullers that have helped us to get where we needed to go. I want to thank you, Jan and Vicki, for the work that you do on behalf of the tribal people. You may never get a lot of gratitude, but at the same time, just know the work that you're doing, it is so important. When I was listening to you, Jan, talk about the framework, I was like, oh my gosh, this is so wonderful. It is so wonderful because it is so power packed. I see in this framework that we talk about the health, the body, mind, soul, spirit, but we also talk about education. Education is so important part of who we are as individuals. One of the elders, he said, Randy Christ, he goes, whenever we step out into the great north outdoors, we are stepping into the biggest classroom that the Creator has before us, and we never stop learning. You always must learn. The Creator is always putting something before you so that you can learn. And so when I think about this framework, I also think about education. I also think about the inherent food sovereignty. We have food sovereignty that is so important. However, because of a lot of the laws and policies that go on, we can't always access the foods that we need to. It is a struggle. It is not easy. Our tribal people, you've heard me say this before, had longevity of life. Our longevity wasn't 90 years, it was 100 years, 120, 130. And I'll share with you again, my husband, he's Elwa. His relative showed him these grave markers, and it showed one brother who lived to be 120 and his other brother who lived to be 130. I know it sounds so that we can't understand that someone could live so long, but it was true for our people. But now we still struggle. We have so many struggles, and a lot of these struggles have to do with probably the food, but also with the social structures, but also some of the historical trauma that we carry. There's so much that goes on that we're still working on. And so when we talk about pulling together, we have to pull together. In this, we also talk, it's not really said out loud, but the polarity. You have north and south. You may have heard this before of tribal elders say, your polarity is a little bit off. We need to do some work on you. They get the feather out and they get the smudge and or whatever it is, and they start doing the work on you, and they're praying for you. And that prayer may not be the words that they're saying, but it might be that song that just kind of goes right into the very soul of you, and it starts helping you to regain the polarity. Have you ever been in the point of your life where things are just kind of, you're so busy, they're bouncing everywhere, and you're like, oh my gosh, I gotta do this and this. And the polarity, we need to bring it together and be able to make those steps forward. So again, pulling together for wellness is so important. And the ability to work with the state of Washington, often I think they don't fully understand where we're coming from. So again, it's a constant education to the state of Washington and to others, because we are more holistic in our approach instead of just sending our people to the doctor, we still believe that, oh, I see you're not feeling good, but I also see you have a sadness. You're kind of sad. Let's work on that. And hey, have you been eating? Hey, have you been drinking your water? So we also talk about the spirituality of people when we talk about holistic health. But I keep thinking back to the pulling together for wellness, of how important it is, not just for today, but also it includes our past, but it's good for the future. I do have concerns. Some of the concerns I have to do with our youth and this time that they're in. And it's so easy for us to forget that some of the youth, they may be at home, but they may be watching what's going on with some of the riots and some of the civil unrest. Maybe it's the elections and all this that's going on, and it creates some hardships in them. And what we want to do with our pulling together for wellness is we want to create a resiliency in our youth, that to kind of have a thick skin, because this world is not easy. Sometimes it can be very difficult, and we need to be able to help our young adults understand about resiliency, about being able to, if they do fall down, and they got to get back up. And if they do have a good cry, all right, it's okay to cry, but let's dry those tears. We know that you're in grief. Let's dry those tears, because your family member that you just lost, they're going to want you to live. They're going to want you to have joy. We have to be able to bring some resiliency to our young people. This is the way I look at it. Right now, in the midst of COVID, we all have been in like the worst storm ever. What else could happen? We're in this storm of COVID and it's smacking us with these big waves, and we have somebody who's belling with water, belling a beller, it's kind of like a little cup, but it's big. And we're throwing the water out, and we're still, the captain's saying, pull, pull, and we're pulling in this canoe. The COVID has created such agony for some people. Moms and dads may not know how to deal with that fear. And some people, when they deal with fear, it comes out like anger. And some people, when they deal with fear, it comes out by the tears. And so we have our tribal people that are in this storm. And what we as tribal people that know we're in the storm, we have to make sure to let people know we're going to get through this. We've been through this before as tribal nations, as tribal tribes in the Northwest. We will get through this. And so again, that resiliency and pulling together is so important. One thing that I do have concerns about is the state of Washington. I worry about, just like our chairman, Chris Peters, mentioned, about those policies and how that they're adhering to those policies. And then at the same time, it's really about the money. It's about the funding and the management care people that are working on these. I am so worried that they're going to try to put aside the good work that happens in some of our care facilities for I'm worried that they don't see the significance of the cultural work that is happening in our treatment centers and how important this is. And I worry about those funding. And I do hope that we as professional people can put something together and keep working on that, so that the state of Washington will understand that tribes can take care of our own in the best way that we can. I also think about the culture. The cultural aspect of wellness is really important. When I was younger, I went to a Shaker church, and you know how, you may not know, but at Shaker church dinners, you stand up and people pray. But when they pray, they don't pray like, oh, we thank you, dear Lord. They sing the song. And I was standing there listening to the songs, and then this one song came up, and oh my gosh, it was like, ooh, it went right to the very spirit of me. I don't know why it made tears come out of my eyes, but it did. But I recognized the power healing in that song. I didn't know who was singing it. Later on, after asking around, I found out it was my uncle. It was my uncle, Buddy Miller. And he had a powerful song. Today, in the yearly canoe journeys, there are powerful songs. They are medicine. Those songs are medicine to our people, and they help our tribal people that are struggling. And then having that drum, having that rattle, but having those times of where tribal people can culturally get together now virtually to drum and sing is so important, because that song is really in here. That song is in our spirit. I believe it's in our DNA. It's there. And that's why we as tribal people, we recognize the how important our culture is. The water, having good water is so important to our people, but we're at a place too where there's a lot of I don't know where Washington State is, but so many houses are going up, so many houses, but they're saying that there's not enough houses for people to get into. I just don't understand that. So we need to make sure that our water sources are protected. Water is sacred. If we as humans don't have good, clean water, we're not going to survive. I remember as a little girl being able to, we used to stop at Kennedy Creek before coming to Grandpa's at Camilchi, and my dad would have us get in there and we'd wash our face, but we also would drink that water, and I just remember how good it was, and it was so good. And whenever I go by Kennedy Creek, I always think, I would just love to drink that water, but I can't because of so much pollutants that are probably in that water. I just want to close with this. The values that we see today are different than the values of our ancestors. Right now, I see a clock over there. It's like looking at me because I have to be somewhere else in about 20 minutes. Sometimes we are a slave to that, the time, but value to the elders, they did not worry about the time. They worried more about, especially if you're water people, about the tides that were coming in. And we were more about the tidal time. We had a different time when it came to the seasons of the year. Right now, we're coming into that winter months. So many things would be happening during this winter months, but our time was so different. So those values, very different. We value our people, we value the health of our people, and we hope that the state of Washington could understand this, and we hope that we can ensure that funding, because we value the people, but at the same time, as you know, everything takes funding, and that's all I have to say. Thank you. I lift my hands up to you in gratitude.
Thank you so much, Charlene. I just so appreciate the wisdom that really grounded us in so many ways around the elements really that are within the framework. And I just so, really appreciate you sharing the depth of knowledge and your experience and the way that you, I know I see you, I've seen you for many years, and the way that you walk in this world, what you share with us at just the right time. And it really is truly a blessing. Thank you so much. I really appreciate it from the bottom of my heart. Andy, Joseph, and you have you unmuted yourself?
Yes. Can you hear me? Can you hear me?
Yes.
Yes, we can hear you.
Yehudkin Squeezed Badger is my name. I'm really honored to be able to speak with the previous speakers. A lot of what they said was very true. You know, our people, I always kind of think of what heaven would be like. And prior to European contact, I would say that this world we live in was the closest thing to heaven. And when the other people came in, you know, they brought in the black robes and a lot of different things, different foods, different medicines. And anyway, I always have to think of my elder. I clean her grave when we have a Memorial Day week. We have a grave cleaning, and my great grandaunt, Mary AIHC Moses, lived to be 118 years old, and when she was in her 90s, could climb up on a horse and ride up in the mountains, and then get off and go around climbing around the mountains on foot and picking berries. She didn't grow that old by eating the foods that we eat today. She grew up by gathering those foods, the traditional foods, the roots, the berries, taking care of salmon, making sure her people had clothing and things, and it was all physical labor. You imagine, you know, hiking about 60 miles one direction and then turn, you know, working around, prying up these roots in you know, about 6 to 8 inches down deep into the ground, and gathering enough roots to stock up your food supply, and preparing them, you know, drying them, putting them away in a way that they will last, you know, for a whole year. And so like, you know, how you go to the store, and some stores might have a great big 50-gallon gunny sack of potatoes. Well, these would be big bags that were probably weaved out of different fibers that or put in you know, buckskin to store away for the year, and you know, doing the same with the berries and the salmon. You know, our people ate salmon for thousands of years, and then you know, they put up dams and cut us off from our food supply. Anyway, you know, getting back to our way of life, I always you know, compare that old time to what it is today, and you know, I talked about the black robes already, and they caused historical trauma to our people. They whipped our people for speaking the language. They didn't allow our people to carry on some of our traditional practices. That was our way of life. So I always say our practices they're evidence-based. We can prove that they work, and it comes from thousands of years of traditional knowledge and upbringing. Our elders would implant that into our minds. My dad calls it kaskasem. Give my kaskasen's testing ima. Give my grandson a dream. So we might be hunting or fishing or gathering, wood and being, with my grandpa or my dad, and they would start, on the way home, and we'd be all tired and wore out from the work. They would start telling us our traditional stories. Some people call them coyote stories. Some, in our language, it's called chaptik. They're legends. And with those legends come, I guess they come with a reason, not to be like the coyote and some of the things that he did. Anyway, as they'd be telling these stories, we'd be starting to drift off into a sleep. And as they start dozing off into sleep, they change the story into, when you get older, you're going to have a job, you're going to work for a living. Or when you get older, you're going to be a good father and make sure your children have everything they need, and you're going to treat your wife with respect. When you get older, you're going to listen to your teachers. Things like that were implanted into our minds, and it was like a hypnosis. For some reason, I turned out the way I did, I guess. Anyway, there's a ceremony that we use when we go gather our first roots of the year, the root feast, the first salmon ceremony, ceremonies of Thanksgiving, and ceremonies where we name our children. When a young person gets their first deer, all these different ceremonies. A young girl gets her first roots. They put them in the middle of the floor and they recognize them for that special reason, that purpose. I remember when I got my first deer, and I give it to this elder couple, and a lady was in our language called Tlaquilk. It means a medicine woman. So that's who I give my deer to. And anyway, once you're recognized as a hunter, then you can go and hunt for the other people that need it, not just your family. And then when you eat that meal, you put everybody in front of you, and you're the last one. Our people didn't always think about themselves in a way where they're going to be, I'm going to get up in the front and take cuts. They were very respectful, and anyway, a lot of our people live by the laws of the teachings, but with this modern world and modern technology, and some of the people that lost their teachings because of the boarding school air, some of them were molested in there, and they a lot of them committed suicide. Anyway, our people honored everything, our foods, our medicines, the land, the water. We honored our youth, and we was always taught to respect our elders. and treat everyone the way that we want to be treated ourselves. Um, um, parenting our youth was a very important part of being a community, being a tribe. Just think of before European contact, we had somebody that was specialized in every different need that was out there. We had doctors that helped people when they were sick. We had special doctors that helped people when they were injured. We had food gatherers. We had our hunters. We had our fishermen. We had our warriors. We had our horse people. We had people that were given special gifts. My grandson is very lucky. Is a good hunter already, and I told him, I says, you're given a special gift to be able to do that, and it's our belief that our people used to mentor the young ones and look for signs when if that person, if their son or grandson will start acting in a different way, they might come to you and tell you that they've seen this animal singing a song to them and it talked to them or something like that. Well, from then on, the parents would mentor that person. They would have an elder watching over them to make sure that they wouldn't be distracted, and that they would protect them from the things that distract one another. In all religions, and there's good and evil. And the way that I explained it to this young man after a funeral during the dinner, I noticed that he had really cleaned himself up. He was walking the wrong path, and I knew that. And when he was a small guy, so the people worked on him to become a horse jockey. We have these big horse races, and it's kind of an honorable thing to have winning horses. Well, he got injured in the horse race, so he had to go to the hospital and rehab. Well, he went through that. He detoxed, and then he had to rehab, and he utilized our mental health and alcohol program, drug program, and I told him, I says, the Creator saved you for a special reason. You have a special reason why you're here, and anyway, I let him know that I was proud of him, and I told him that most of the most powerful people I know, both in tribal leaders and spiritual people, that they had to overcome obstacles, temptations. We believe the evil side will have somebody that he controls try to attract our young youth into drinking or drugging and causing harm to themselves, because the evil one don't want these young people that are gifted to help others, become a part of the community like they're meant to. With this modern world we have all our young people with these gifts, and nobody's teaching them which way to go. It was touched on a little bit about the canoe journeys, and I in my the last 17 years, when I first started on council, I noticed the canoe journey movement getting stronger and stronger, and hearing how the canoe families required the youth to be alcohol and drug free, and the elders taught them the songs and mentored them. That spirit that was talked about entered into these young ones' hearts and their minds, and it's putting them on the right path. What we need to do is get all of our young people on the right path, using our own traditional teachings, and being able to survive that way too. We need to be able to, back in the days when we mentored our young people, we weren't we wouldn't ask for anything, but the people who we helped would offer us, they might offer us some of their food that they gathered. They might hunt a deer for us, or they might give us some of the buckskin or clothing and things like that, the blankets that we need to keep warm. Anyway, this modern day world we have, those practices, I would say, would probably, if we documented the success, would heal more people than the modern teachings that psychologist or psychiatrist is pushing onto their patients. That anyway, I truly believe in our spirituality and the teachings that are very important to us. Anyway, I could go on and on and on about this. I just want to let you know it's the best practices that could save the government a whole lot of money in the long run. We wouldn't have so many parentless children running around out there. We wouldn't have to bury so many of these young parents because they weren't given the proper teachings. And anyway, it just I would if people need to see how some of these practices work, you could come over to the Healing Lodge of Seven Nations and see what they're doing. Some of the different programs in tribes and also our urban health centers, they're working on traditional practices and medicine. Some of our medicinal plants, and I just think that let's say a young girl is out there digging roots and learning about her foods by an elder. She's getting the teachings. Some of my real good teachings is when I go salmon fishing, and I would talk to the elder fishermen, and anyway, or I would go to a spiritual ceremony, and they might have a sweat. You know, the sweat house is I would call it one of our oldest churches ever. That you know, I have one, and I teach my children and my sons and my grandsons. As men, we don't sweat with the females. So, but anyway, there's a lot of traditional knowledge that it's passed on from one person to the other. And anyway, I just want to let you know our practices are evidence-based, and we live our religion. Our religion, you know, there's prayers and everything that we do. When we're gathering plants to make baskets, or when people are making baskets, you know, they're praying. You know, that tree that they got the material from. All the plants and animals are just like us. There's females, there's males. They germinate and they have offspring. They need this world. They need sunlight. They need darkness, and they need water. Water is the medicine for everything. And anyway, we can't live without that. And some people wonder, you know, they might hear about some of our remedies that we use for medicine. They might go out and gather it, but if you don't talk to it like it's one of us, it's just going to be a plant. It don't become the medicine until the Creator makes it the medicine, because we ask it to, and the Creator hears it from our heart. That makes it work. And believe me, that with this COVID, some of my patients that I brought medicine to, they overcame it pretty fast. COVID don't like the heat, and it, I believe it can be cured with our medicines if we, you know, ask it to. But we have to leave an offering, and we want those trees and plants to always be here for those 7 generations. It's our duty to make sure that we respect the land and everything it gives us. And if we do that, in 7 generations from now, it will be here for our children's great grandchildren. Anyway, it's the way that our teachings, you know, brought us up. So that much I wanted to share. You know, when I quit drinking, I asked my elder. I told her I think I might quit drinking, and so she was having a spiritual dance, and she told everyone to pray for me. And it's in the winter time, and there's a tree in the middle of the room, and the prayers all go up that tree. And she sang her spiritual song, and I never had the urge to ever drink again ever since then. I can't stand the smell of it. So and believe me, that was a miracle. So you know, we could do the same with our youth. Sometimes we need to ask our youth what's bothering them. They might, you know, we could give them the suggestions that our elders gave us, and it might make sense to them. That young guy I talked to, he said, I wish I would have talked to you a long, long time ago. I told my son it's like Star Wars. Luke could have been a real powerful Jedi, but he was influenced by the dark side and they took control of him. It's the same way with our children. You know, they're being distracted, and the dark side takes control of most of them, and it's our responsibility now to mentor them in a good way. Get back to what heaven was like before. AIHC, that's all I have to say.
Thank you so much, Andy, just for giving us some really great context. And I just so appreciate the depth of your understanding and experience. You know, some of the things that you talked about, just the importance of prayer. And you know, when presenting the framework in the early days of presenting that framework, I recall words from you, and in thanking the commission for doing good work for Indian people in the state of Washington. And that was, I think that was in 2014. And so that was a long time ago that we've been working on this. And it just really speaks to how important it is just to keep at it, because things don't, you know, happen immediately, especially when they're something that is kind of this big in terms of, you know, getting everyone to a level of understanding. Another thing that came out of that discussion was that it was recommended that prayer be included in the framework. So there was kind of standard thinking in public health is where we live, work, and play. And from that meeting, and I don't remember if you said it or if it was someone else that said, oh, no, we need to have prayer in, you know, in this framework because that's what we do. And there's importance in that. And so anyway, you know, all of these stories that are part of this framework keep coming back to me. So thank you so much for your, you know, for your words and inspiration. And anyway, I know that you've just joined the Pulling Together for Wellness Leadership Advisory Committee, and I'm just so excited about, you know, you're joining this group as well. There's a lot of work that we have ahead of us this year. And one of the things that I just want to mention, I know Vicki wants to cut me off here. And one of the things I want to mention is that, you know, in the great work that tribal leaders did this last year in including historical trauma definition in the Indian Healthcare Improvement Act and the behavioral health legislation that was passed last year, and in Vicki's fine work in moving that forward. Well, you know, that same context is not put in public health. At least from my understanding, it is not, and it needs to be. So, you know, it really needs to be in our statutes and recognize that that adverse childhood experiences is an outcome of historical trauma, historical intergenerational trauma that has really been based upon that, you know, that historical experience and some of the policies that were rooted in racism in the formation of this country. And I know that sounds a little harsh to some, but it's just the truth. So, you know, I'm hoping that there's an avenue for us to deal with that. So anyway, thank you, Vicki, for allowing us this extended time. And thank you, Andy and Marilyn Scott, Charlene Nelson, Charlene Kreis, for you guys just bring me such great inspiration to this work, and we're going to move forward with it in a really strong and positive way. Thank you.
Thank you, Jan. Thank you, Andy. I think the Charlene's had to leave, and I don't know if Marilyn's still on, but, you know, and this is, I know it was kind of took a while to get through it all, but this is such a really important concept, and we're trying to pull it in, into all of our other work. Also, I think we're getting locked into the building here in a minute. So I just really appreciate you guys, you know, keeping this work going, and now I think we're finally at a place where we're more able to incorporate it into the rest of our work. But also, I think as far as society is right now, there are more open-minded, well, there's a lot more closed-minded people, but we also have more open-minded people, and that's what we're talking to and looking at us as our allies to move this work forward. So I'm very excited.
So Vicki, I just want to say that is, you know, something that I neglected to mention is that, you know, allies are just critically important in this work. And I always like to just mention Sue Crystal, who was the health director for the Healthcare Authority, and what a strong ally she was. Sue Crystal passed away in 2001, but it was, you know, I guess it goes to some of the concepts into the generational clarity work too. I think Marilyn just jumped off. Did she want to say something before?
I don't. So while Marilyn's deciding to turn her camera on again or not, I just want to thank everybody who stuck with us. Don't forget, we've got breakout sessions tomorrow. We have the Elders and Youth panel next Friday, the 13th. And then on November 16th, we have a bunch more breakout sessions. They're all on the website. And that's where we can have these longer conversations. I mean, they're only an hour and a half, but we'll have the more focused conversations on the different work that we're doing and how we can incorporate the Pulling Together for Wellness framework, but also we need to hear your voices about the work that we've accomplished and where we need to go with it now. So thank you. I think there's one more comment. Okay, I don't think there's a comment.
Oh.
All right. Well, thank you, everyone. I think we may have lost Marilyn. So have a great evening.
Okay.
And hope to see you tomorrow and the rest of the days for the breakout sessions. Thank you. Oh, there's
Steve.
There's Steve.
Okay.
Do you want to say something, Steve? Steve, did you have some final words?
I just wanted to say thank you, everybody, for a great day.
Thank you. Oh, there's just some thank yous in the comment box. So thanks. Have a great evening. And we will see you soon. Jakes.